a bit disconcerting, but welcome everyone to the Adults and Health Scrutiny panel. So I'm Councillor Connor and I chair the Adults and Health Scrutiny panel. It's obviously a hybrid meeting, so there is a recording of this meeting happening. So just to note, anyone joining the meeting will be recorded, and this can be sent out by the council onto our own website, and other people can then obviously hear and see all the comments made during the meeting. I say that with understanding that actually some of you may not be seeing us, but hopefully some of you can see us now on the laptops. So I'm going to just get everyone in the room to introduce themselves. I think that's going to be very sensible before we move on. So I've introduced myself. So Councillor Peacock.
I'm Councillor Sheila Peacock, Councillor for Northumberland Park.
Kieran Sanger, I'm the Associate Director for AHP and the Haringey Borough Lead, representing Whittington.
Okay, so I turned on my camera, but my face still seems to be there, so I don't know what's happened. Because I can see me on here, but I can't see myself up there. No, doesn't matter. Everyone knows who I am. They can tell by the voice. So I'm Councillor Gideon Ball, Councillor for White Hart Lane, and I'll place on record that I work for NHS England, but the role that I have at NHS England has no conflict with working with this committee. Thank you.
Thank you, Councillor Ball. Dominic?
Yeah, Dominic O'Brien, Scrutiny Officer to the panel.
Lovely. And then, so I'll take it from the top left. I've got Councillor Desneves. Do you want to just unmute yourself and say, you introduce yourself?
Thank you, Chair. I'm Lucia Desneves and I'm the Board Councillor for Woodside Ward and the Cabinet Member for Health, Social Care and Wellbeing.
Thank you. Okay, Dominic, can you read out who you've got on yours? Because I think I've got different to...
Right, yes, we have Paul Allen is here.
Hi everybody, I'm Paul Allen. I'm Head of Integrated Commissioning for Older People and Frailty for NCLCCG and the London Borough of Haringey.
We have Alison Ketts.
Hi, I'm Alison Ketts. I'm the Director of Operations for the Adult Services in Whittington Health.
Thank you. We have Jenny Plummer.
Good afternoon, everyone. My name's Jenny Plummer and I'm the Interim AD for Adult Social Care, sitting in today for the first time. Thank you.
Yeah, we have Charlotte Pomeroy.
Charlotte, do you want to unmute yourself?
Yeah. Hi, I'm Charlotte Pomeroy, Assistant Director for Commissioning. Hello.
Thank you.
And we have Marissa Rose.
Hi everyone, I'm Marissa Rose. I'm the Director of Continuing Healthcare for North London CCG.
Thank you.
Okay, I think that's everybody I have at the moment.
Okay, so is that everyone in the room?
Oh, sorry, there's just one other joint. Dr. Asagi from North Mid.
Hello, good evening. Apologies for being a little bit late. Thank you.
Anyway, thank you for joining us. Thank you. It's a bit of a strange hybrid system we've got going on at the moment. It's not working brilliantly, but we're going to do our best. Yeah. I think is the order of the day. Okay, so thank you everyone for introductions. Apologies, Dominic.
Yes, apologies received from Helena Carnier.
Thank you, and I've got apologies from Councillor De Costa, who might be joining us on the live stream later, if you can. Items of urgent business. Any items of urgent business?
Yes, so there's a late report which has been submitted on the possible relocation of the Grace organisation to the former site of the Irish Cultural and Community Centre in Tottenham. Some members of the panel visited the site earlier this week on Tuesday, and so we've just put together a short background report on that, and members may want to discuss some of the issues around that.
Thank you. But what we'll do is we'll hold that until the end, because obviously colleagues have come on with the agenda item 7, so the discharge, we'll do that first, so you know. Declarations of interest. I want to mention that I'm a member of the RCN and my sister's GP in Tottenham. Councillor Bull, you've already done your declaration of interest. Councillor Peacock, anything you wish to add? Okay, thank you. Any deputations, Dominic?
No, none received, Chair.
Lovely. Minutes on pages 1 to 16. Are members happy to approve the minutes? Now, there are a whole raft of actions. Again, we'll take those at the end of the meeting, just to ensure that colleagues who are on the call, we deal with that agenda item first, and then we'll do the actions on the minutes, which is a separate document that was sent to you. Are you happy with the actual minutes?
Yeah.
Agreed?
Agreed, yes.
Okay, thank you. So we'll go straight on to item number 7, Haringey's integrated discharge arrangements. This is on pages 17 to 22. We've actually, just so that everyone's aware, we obviously, this is a scrutiny committee, so obviously we want to have plenty of time to ask questions. So I know some of the issues can be slightly complicated, but I would really appreciate it if, I think, Paul, are you introducing this? If it's kept really brief, and if there's anything that's complex, we'll deal with it as we come up in the questioning, if that's all right. So that would be really helpful, thank you. So Paul, over to you to and introduce who's going to be also speaking to this item. Thank you.
Thank you, Chair. So I'm going to be brief, like you've suggested, but I'm going to do a bit of a double act with my other colleagues who kind of work for social care and the NHS. And I'm going to invite Marissa to talk about the continuing healthcare section. So I don't know, Chair, whether you want to break the section into two, whether you want to pause for discharge and then talk about the continuing healthcare.
Yeah, I think there's a natural yes. So
okay.
We'll with the discharge and then go on to the continuing healthcare. That's all right.
So if we cover the discharge bit first, then I'll just very, very quickly recap the kind of findings. The first thing I would stress, and the reason why there are so many colleagues on the call, is that we do regard across the Whittington and North Middlesex as being a genuinely multi-agency effort to try and discharge people safely and timely, ideally to their home. But you know, and that's kind of the home first policy. But certainly to help them recover as far as they possibly can. And we've got a process called Discharge To Assess. The idea being essentially that many people need to be kind of discharged from hospital, and then their assessment about their long-term care needs can happen after they've recovered, again, ideally within their own home. So during the pandemic, we've adapted our kind of discharge to assess model. But the other thing I would stress within the report is that idea of people being able to recover as far as possible before making a decision is something that we were doing within Haringey and wanted to progress within Haringey pre-pandemic. And if like in one kind of sense, the pandemic has just simply accelerated either some of the plans we've had or reinforced the importance of that discharge to assess model, but also give us some valuable kind of breathing space in terms of kind of additional funding and focus around it. So as I say, I'm not gonna labour the point that you can read within the report around the kind of the numbers and proportions within the kind of hospital, but just to touch on briefly some of the changes and then some of the thinking that's gone on beyond that. I've already mentioned about the funding, but the other couple of key other points that we've kind of developed during the course of the pandemic have been the establishment of acute-based and multi-agency integrated discharge teams, typically led by community health providers such as Whittington Health. We've got colleagues on the call today to talk about that, both at Whittington and at North Middlesex Hospital as well. They work in partnership with other partners in the health and social care system. We've also changed some of the reporting requirements nationally, so to focus on delayed discharges, but that's no longer a metric that's kind of used, and we've used alternatives about length of stay within hospital. And I've got to say, within the report, particularly paragraph 3.8, it describes some of the important progress we've made in that space in Haringey. And I'm sure that people will want me to talk about the post-pandemic arrangements. So this report was kind of written immediately prior to the very recent announcement from the government around extending the funding beyond September period for the additional costs and burden of out-of-hospital placements, which I've got to say I think we kind of welcome. in terms of taking some of that additional burden, because we have seen a bit of a step change in the kind of the number of patients coming out who do need support from the council. But we are looking at a whole range of different solutions to try and support people out of hospital, to build on our kind of progress that we've made so far. So I think I'm just going to pause there, Chair, if that's okay, because I just want to respond to what you're saying about actually giving people as much time as possible to kind of interrogate that.
Excellent. Thanks, Paul. And thank you to both everyone from Whittington and North Mid on the call tonight, because obviously this is a partnership, and obviously you're going to have your own stresses within your own systems. So is there anything that anybody wanted to raise at this point, either in the room or on the call, around particular issues that you're finding either the Whittington or the North Mid, that you would like to flag up with us at this point, or do you want us to go straight into questions? Okay.
I think that certainly, I mean, this is Alison from Whittington Health. I actually represent the community, but obviously have a very close eye on what's going on in the hospital. I think we can all generally say that that during the winter months last year was particularly challenging, and things were absolutely unprecedented. But I think what we're facing now is a situation where things have plateaued. But going back to what we were doing pre the pandemic is probably not a place that we're in. We anticipate this winter to be a challenging winter. We continue to have patients in the hospital who have COVID, and we anticipate that situation will continue throughout the winter months, on top of our current normal caseload that we experience in the winter. I guess, where I stand at the moment is from a community perspective, is we have been given additional funds to support prevention of hospital admissions. So we've been given quite a considerable amount to anticipate patients who are beginning to deteriorate, to prevent them from and give them support before they come into hospital, and also our rapid response services, so we can prevent patients from that are coming in from 999, take them from 999 or 111. Or from GP practice, which we are doing. So we are increasing our workload in the community in order to prevent that, and we hope that will help us, in the future and during this forthcoming winter, to be able to prevent, crises occurring. I'm sure I know that Nano at North Mid is also likewise with us. We have gathering our regular meetings on a monthly basis, so that we are including not only our community services but all of the services within the hospital together, so that we can make flow during the hospital, during patient stays in the hospital, not any longer than they actually need to be, and that system working feels in a much better place than what it was before the pandemic, and it does feel that we're in a much better place to be able to do things better going forward.
Okay, thank you, Alison. I've got Councillor Bull, who's raised his hand. Sorry, I've also got Stu from the North Mid, Chief Exec. Do you want to come in and then? Yes. If you'd like to come in first, and I'll take Councillor Bull.
Sorry, it was one to recognise what both Paul and Alison have said. To commend the interagency working, I think that has really materialized through COVID. And then just to emphasize that although we sit here and we talk about discharges in sometimes what feels like abstract ways, this is about best place for patients, and it impacts all the way through to our emergency department. Because if we don't have the right discharges at the right time, we tend to have an inability to rapidly admit patients through our front door. And that's one of the reasons why we chair a joint A&E delivery board that looks at inflow, through flow and outflow, this being a really important component. And then just to talk about people, 21 days is a surrogate measure, because there's some people who genuinely need to be in hospital beyond 21 days, and there's some people who don't. So there's a surrogate measure, and we also look at leading indicators in terms of those who are there 14 days and those who are there for 7 days, so that we don't tip in to that 21-day cohort. I just want to say thank you and to recognize that this is a system effort that does need to continue. The funding decision has been very welcome, and it is going to be a difficult winter, so we are going to need to work on the reducing conveyance to hospital unless needed, optimizing time in hospital, and maximizing that discharge.
Okay, thank you. Thanks for that. It's very helpful to hear straight from the hospitals and the community. So, you know, this whole partnership approach is what we're here to look at today. So, Councillor Bull, would you like to ask the first question? Thank you.
Yes, so my question is on the basis of the impact of COVID on both Whittington and the North Mid. And actually, talking from personal experience, I had to call an ambulance twice about 3 or 4 months ago within a 2-week period for breathing problems. Yeah, no, I had a myocardial infection a few years ago, so anytime I have any breathing problems, it's naturally assumed it's that. But actually, it was musculoskeletal inflammation, so they're very, the symptoms are very similar. Anyway, I digress. And when I got in the ambulance that picked me up at my address and took me to North Mid, one of the challenges, and we've known this from some of the burdens and pressures on trust during the winter months, is the fact that I think I must have sat in the ambulance for about 50 minutes waiting to be discharged. And I remember, because I've known North Middlesex for a very, very, very long time, I remember seeing fleets of ambulances sitting outside waiting to discharge their patients. And I actually spoke to an ambulance driver who was from the police force, who had to come out of the police force to help the ambulance service because they were just completely overwhelmed. All the preamble leads me to the question, which is, has there been any analysis done on a month-by-month basis of the specific impact of COVID on the ability of the ambulance service to discharge their patients into the 2 emergency departments of North Mid and the Whittington? So that's my first question. I've got a question about the way that patients are discharged, but that'd be my first question. Thank you.
Okay, so that's really going into hospital from the community. So would anyone like to sort of pick that up?
I'm sure Nana and I are going to have similar responses to this. I mean, I absolutely know that there's been enormous amounts of, I mean, I don't work in ED and it's not my responsibility, but however, I know there's an enormous amount of scrutiny about offloading. And certainly when I'm on call and I hear that there are delays in offloading, then, you know, that often comes from the sector to alert us and find out specifically what the problems are, because of course, when our ambulances can't offload, it means they can't get to the next patient who needs an emergency pickup. So all of the work that we're doing, and you know, it's like, and you know, and so fortunately, it's, you know, they are all interconnected, and offloading from an ambulance and getting the patients in to be seen is all part of that process of those patients in ED being seen and admitted if they need to be admitted, and seen and sent home if they needed to be seen, and the connection between that and community and flow, and using our colleagues in local authority to help us, you know, to ensure our patients are flowing through. They are all connected, and I guess so. Yes, is the short answer, but it is all connected, and yes, we scrutinise it, and we are scrutinised about it. So yes.
Okay, thank you. I've got Nanina. Do you want to come in on that answer, and then do you want to add anything about figures?
Firstly, to just recognize and hope that you are well. It sounds like it's been a difficult couple of months, so to just recognize that. I think Alison has mentioned already that the key components. One is that the longer it takes for an ambulance to offload, the more the hidden risk in the community, because once you're in the front door of the hospital, we know where you are, we can measure you. And then secondly, the degree of scrutiny, just to exemplify. We look to unload 95% of our ambulances within 15 minutes. And then we monitor that, and we monitor how many we offload within 30 minutes and within an hour. And by the time you get past an hour, it's quite a significant breach, and that is nationally and regionally monitored. So yes, there's an intense degree of scrutiny. And again, to then highlight the importance of, one, making sure we're conveying the right people to hospital. and looking at the disproportionate conveyancing that can happen, and making sure that people who are utilizing ambulances are people who need it the most, so that we can always prioritize that unknown risk that sits within the community.
Okay, thank you. Councillor Boyle, you have a follow-up question?
Yeah, so I've got to follow up on that, and then I'm just going to ask about the delay discharges. So my observation about the ambulance service is, I have to say, I think it's part of the NHS that's long overdue for review. You know, there's only 10 ambulance trusts in the country. Yeah, there's only 10 ambulance trusts. East of England, and I know obviously I know East of England, this is Coast Clacton where my parents live, covers 6 counties for one ambulance trust. London Ambulance Service obviously covers the whole of London. So I think there's probably some discussion needs to be had about the review of ambulance service. But the government are very quick to want to review adult social care and mental health and all this, that, and the other. I think the ambulance service needs reviewing. The question I wanted to ask about discharge, and I don't mean this in a flippant way, it's regularly accepted out in the community and in the NHS. Hospitals are a place where you go where you're sick, not a place where you want to get well. Out in the community is where you go back home as quickly as possible, making sure that there's the infrastructure in place. Because one of the concerns we've had when we were looking at some of the adult social care cuts that unfortunately previous administrations had to make is the impact that has on the NHS, or delayed discharges and what have you. If there's not the infrastructure in place at home, in the community, then it's very difficult for the patient to be discharged. But I was saying to the chair before the meeting started, and this is directed principally at North Mid, and it's good to see the chief exec here. You've got big shoes to fill with Maria Kane as your predecessor, so welcome to Haringey, welcome to this meeting. My observation was, years ago, we did a visit to North Middlesex Hospital, and Enfield had people from the adult social care department actually stationed in the hospital doing the assessments before the patient was discharged, and Haringey didn't have that. What is being done now to ensure that the proper assessments are being done on the patients, to make sure that they're not just being, how can I put it, pushed out of the door and asked to fend for themselves? And I'm sure that's not the case. And I'm sure that, you know, the perception that residents have of that is probably misplaced. But I need some reassurance that we are looking after the most vulnerable in our society. Thanks, Chair.
Okay, so who would like to lead on that question? Okay.
So I believe that was directed at me. So I'm going to start off by saying that I wear my own stilettos, but recognize the work that has been done before me. And I'm grateful both to Maria and to Andy for the tremendous improvement work that they have put into North Middlesex. Secondly, to say that we work hard to make sure our discharges are safe. And that is about clinical safety, making sure that the condition that's brought someone into hospital is resolved or maximized before they go, but equally to make sure that they are safe from a therapy's point of view, so that we will have assessment by therapists as need be before patients leave hospital. But thirdly, and importantly, in the spirit of the partnership we're discussing today, recognizing the importance of non-health related considerations. And there's a lot of work we're doing now with connected communities, covering both Enfield and Haringey, and picking up on the other aspects that are hugely important to people's qualities of life. So we are conscious of this, and there is a systematic approach to this. Obviously, what we want to do is to then also have that touch point after discharge. And that touch point, as Alison spoke about, pre-admission, so that we can deal with some of these even before people come into hospital. Very lastly, to say that we've been piloting a ward at the Chase Farm site called Canterbury Ward, which gives us the opportunity to focus on these aspects of care before someone leaves the hospital. So it is a priority. It is being looked at. It's being looked at systematically, and it's been looked at in partnership.
Thank you.
If there's time at the end, I've got one more.
Okay, but we'll just ask, because we need to healthcare as well.
Yeah, sure.
So, Councillor DeMere, so welcome. Are there any questions that you would like to ask this point?
Not at this point. I think Gideon already asked my question around the arrangements when patients are coming in and the delays in discharging patients, particularly to social care. I know where I work, there is considerable delay when and I'm working mental health is slightly different. when patients are ready to be discharged, they often find themselves having to stay in hospital a lot longer because the support housing scheme, residential care home, or things like that haven't been arranged in time. But that's going to be better because, as Councillor Bull alluded to, that we have people, local authority has people on the ground within the wards working in multidisciplinary teams to identify those delays before the patient on day one, really. So those issues that can take some time are dealt with as soon as they arrive, rather than dealt with when they're ready to leave.
Okay, thank you. I think we'll hold that point. Hang on, Councillor Bull.
That's small because it's about mental health. I promise it. It'll take me
We're not doing mental health.
I know, but it's about patients that get admitted to the ED
Hold that
with
thought.
mental health.
Yes.
Issues.
Hold that thought, because with Councillor Peacock.
Thank you.
That's all right. Hold that thought. We'll come back. Councillor Peacock.
Thank you very much. On Friday, the 13th of August, and unlucky for some, and certainly unlucky for me, I collapsed in the top of my road, and an ambulance was called because I was literally on the ground. And it took 3/4 of an hour before the ambulance came. It took me to Northmid, and I was a very long time in A&E, but I'm not talking about that. I was discharged on the following Thursday. My doctor, when I got home, phoned me, but not on this reason. They phoned me about something else, because I'd had an MRI scan prior to this on my back, and she was phoning me up to tell me the results. And I said to her, I've just come out of hospital. Happy, she said, I know nothing about that. She knew absolutely nothing. I've been in hospital, the reason I've been in hospital or anything. So I said, but my friend over the road dropped in my discharge papers. You should have seen it. She said, I haven't seen it. And so she said, I'll ring you back in 3 days' time when I've had a chance to read up exactly what happened to you. So there was our discharge, but the hospital never informed my doctor. I don't understand that. I would have thought that any hospital would have done that straight away.
Okay, so that's really a question about sort of that communication, isn't it, with the partners, the GP partners, in order to make sure that when people do go home, that the clinical or person who will be providing any clinical care, potentially the GP, is informed of the discharge, and also what other services are involved in case they needed to intervene or add to those. So, Alison, is this, sorry, or some of the room, sorry, I can't answer what you said. Kieran, obviously, you're in the room, and we haven't actually heard from you yet. All this way. Is there anything you wanted to sort of say, or is there, something around Whittington protocol that has that?
I know I'm looking at possibilities. Systems, so the GPs are one system.
Sorry, madam. Someone's got them. It's gone now.
Sorry, switch off.
You get that hair dryer.
Yeah. Sorry, Dominic.
Right.
So I know from Whittington Health, what we've got is what we call care centric. So we can now be able to read each other's notes. So in theory, what should happen is if you were at the Whittington, that they should be able to see the actual notes that were from the hospital. It's only read-only, which is more than enough. And that is a piece of work that we have been doing. And it's also an NHSE digital innovation as well. So the aim is that no matter what system you're on, it will talk to each other and we'll be able to read the notes. So it's definitely on the NHS's radar, the importance of communication, and that actually, no matter where you are in the country, no matter what system you're on, it will talk to one another.
So I was going to ask, sorry, Councillor Peacock, but so if she was at the North Mid, weren't you?
Yeah.
So would that work with the North Mid? Is care centric also? Yes. Anima, would you like to answer that? Sorry, I know you're answering a lot here.
That's all right. I'm happy to. So there are a couple of things. One is to recognise the digital innovations. The example of which in London is the One London, which will allow us to look into each other's systems. So recognizing that and to say that has moved forward quite a bit, there's still a bit of work to do. Secondly, just to probe a little further, because I thought I heard that the discharge bundle and paperwork your friend had dropped in. And within that, one would expect the discharge letter to have been included. So I wasn't sure if it was a matter of timing rather than the process itself, because the process is that when you are discharged, a letter is created and that letter should be with your GP within 48 hours. So that's our process within the hospitals. I wasn't sure what you were describing.
The doctor never received anything from the hospital. They only received a piece of paper that I gave to them saying I had been discharged. There was no follow-up procedure, nothing. And I might say this is not the first time it's happened, because a couple of years ago I was in a similar circumstance in the North Middlesex Hospital with pneumonia. And again, the doctor there never knew when I came home what treatment I had and what treatment I should be having. And no follow-up.
So can I invite you to maybe email me the specifics? Because as I say, our process is for that paperwork to be with your GP within 48 hours. And we do look at this performance. So if there's a specific instance, I'm very happy to look into it and see if there's any other learning from that. But that is how the system has been designed at North Middlesex, because it is important for us to transfer that information in a timely way. I can see Rachel wants to come in as well.
So just to mention that we have got a clinical interface meeting, which is an opportunity where the GPs get together with the senior clinicians, medical director, etc., from North Middlesex, and we've got an equivalent with Whittington Health. And it is a good chance for people to, if there's something that's more than a single case, so if there's something that is happening systematically, to do with the communication between primary and secondary care, it's a good opportunity for us to kind of have a discussion about it. There are lots of interface issues at the moment because the system is under a considerable amount of pressure. But what I would say is, pending Nena's investigation, if this is something that is where there was some kind of system problem, that the discharge summary wasn't getting sent through in a timely way, or that it wasn't being picked up in primary care in a timely way, and it might have been either of those things. But it is the kind of thing that we would bring to the clinical interface meeting to have a conversation about and work through. And we do that for other sorts of interface issues if there isn't really tight communication happening between primary and secondary care.
I would have thought that when the discharge paper was printed off on the computer, that it could be set at the same time because you sent it to the doctor. There's no delay.
It normally does happen.
It happens in countries, and it should happen here as well.
Yeah, I can't speak up. I think that's what Rachel's saying, that you're right, it should have happened.
Yeah.
And actually, but this raises a sort of slightly larger sort of scrutiny more question is how do you identify these sorts of issues? Because I mean, Councillor Peacock's happen to have that, and it's been brought to the scrutiny committee. So we're talking about the interface meetings and the different boards that are meeting, and I can understand there's an enormous amount of work going on at the moment. So not to add to your workload, but it's just for us to have an understanding of how you pick up issues in the sort of with people that have gone home who are no longer part of that hospital setting. How does that get fed back to you? Because I would imagine that if I was a patient and something had gone wrong, my GP might know about it, may not, depending on what the situation was and how easily it was addressed. So how does that conversation happen? Because I imagine the GPs are incredibly busy and are not going to be sort of just constantly something, oh, that's a thought that I need to bring up. So is there some sort of meeting between the Whittington and the North Mid and the community where you all sort of sit there and go, right, okay, we've had feedback from these sources and you're actively seeking that feedback? Or is it just when situations arise that you then flag this up?
I know from a community perspective, we often get discharges as well from the hospital. So if we get a discharge that actually there's been any issues, we raise a discharge alert. So that in theory should then go and it gets scrutinised, doesn't it? So there is a culture. We do make mistakes. Things do go amiss, but the governance should allow us to be able to pick that up and raise it, and then from a higher level, from a governance level, is pick up any patterns and think, why is this happening, and then put something in place.
Okay, so, and does that go to the hospital? Sorry, is that
it should do.
Okay, because that's sometimes we find in these things, systems that it should do, but maybe the person who was doing it, has gone or whatever happens or moved, or there's been reconfiguration of services. And I'm just checking now, because we have hospital, we've got chief exec present for the North Mid. I'm just checking if that is a system that is in place. Is that something that you're, Nina, are you sort of, is that something, or is this too detailed a question? It's just something that would be useful to look into and come back on.
So Councillor Connor, so what I would say is that there are a number of systems. One is monitoring the performance of the commitments we've made. So we should be discharging and sending correspondence within 48 hours. And so as part of our business as usual, we've been monitoring performance against that and picking up exceptions and dealing with it. So that's one, that's a proactive step. Our CCG colleagues, of course, will be holding us to account on a number of such indicators, not just that indicator. And we also actively survey, as Rachel has indicated, so various quality alert systems, where not a single case, but where there seems to be a thematic vein of similar issues, and that is raised through CCG with the hospital. And that interface meeting is helpful. Lastly, there's obviously the sort of individual but important feedback mechanisms, including complaints. So where we get complaints, they can be raised into incidents if we find that there is something that is of a system or process issue underlying it that we need to pick up on. So those are all opportunities, and our broader monitoring. And I know that mortality is often a very crude indicator, but our performance is based not just on what happens in hospital, but also what happens 28 days after discharge. And so when we look at things like mortality, we look at immediate mortality in hospital and also 28 days after. So we remain open to understanding the impact of hospitalization and post-hospitalization. I hope that helps to clarify.
It does, and I'm sorry, we've got Councillor Paul, and then we do close this part of this item down in the next minute, I'd say, in order to get the continuing healthcare on the discussion. So apologies, but I'm not going to ask everyone now to be reasonably brief.
Well, I'll be really quick, and I'm afraid this is again a question for the North Mid. So the last time, Chair, that I was at the North Mid, I picked up that actually there'd been 31 cases that morning in the A&E of people presenting themselves with severe mental health issues. And I can't see your name from here, but I'm just going to call you Chief Exec at the North Mid for now, if that's okay. I know that you have a special ward at North Mid, and I can't remember the name of the ward, but there's a special ward where these patients are admitted to. My question is probably about, and it is about discharge, because we're always talking about people with physical ailments being discharged in the community. We mustn't forget that people with mental health issues being discharged in the community is really important. And perhaps if we look at this in the future, the mental health trust coming would be really, really, really important.
We've got a whole section on mental health on another agenda. So
let's just be mindful.
We were doing the physical health aspect, or in that sort of hence the people in the room today. So okay, that's noted. Thank you, Councillor Bull. So very briefly, Alison and Beverly, did you want to come back in?
I was briefly just going to respond to the discharge alert and just briefly say that the benefits of now coming together as an ICS, and for anybody that doesn't understand what that is, but that's an integrated care system which is across NCL. We are working towards standardising process, and a member of Whittington Health is leading on the discharge alert process, but to ensure we're standardising that across NCL. So just for that reassurance.
Thank you. Did you sort of hand up? Are you wanting to say anything?
Yes, thank you very much, Chair. And once again, apologies for coming late. The point may have been made already, but I just wanted to emphasise the integrated nature of the discharge team, the role of our social workers, the role of our integrated reablement and rehabilitation teams. And that's very much part of the sort of the systems way of working to support individuals with discharge. I think if there's aftercare identified for individuals, that very much works very well, and there's very much that sort of very a smooth pathway. I think going back to Councillor Peacock's case, because I do know a little bit about it, she was discharged home without any sort of identified follow-up needs. She's talked about her own resilience, etc., etc. So we'll be happy to go away and look at any gaps in processes for people who don't have that sort of integrated aftercare follow-up, to see how we can work with our hospital colleagues to close those gaps. But I just really wanted to emphasize the importance of that integrated aftercare, whether it be reablement, our social work team, our rehabilitation team. Thank you.
Thank you, Beverly. That's very helpful. So I'm going to close that part of this part of the agenda down. So we've got at 3.15 NHS continuing healthcare processes, which is hugely important for our residents. So I'm just going to ask a couple of quick questions and then open it up to the panel, the other councillors on the panel. So I'll start by saying the continuing healthcare funding. So my understanding is that a couple of years ago, the budget for this was so my question really is, if somebody requires continuing healthcare funding, which is nursing funding at home, really. So if you've got a something that could be termed as a sort of medical and nursing sort of need at home, or in a setting that's not within a hospital, you can apply for this funding. So it's not just social care funding; it's actually continuing healthcare funding. So that's funded by the NHS. So this is the CCG. I'm looking at Rachel, looking on here, that would pot of funding goes through that system. So my question is, if there are more people that need continuing healthcare funding than the budget is available for, is it a case whereby there is a restriction on the funding available for each person, or is it a case that the CCG goes back up to whoever in the NHS saying we have X amount of people who need extra support at home, and therefore we need a bigger budget? So I don't know how flexible that request for extra funding is. So I'm going to start with that question, and then I've got a follow-up on that, and then I'll open up to the panel. Thank you.
So, Chair, if it's okay if I come in, I'm Marissa. I'm the Director of Continuing Healthcare across North Central London. Got Lily, my PA, with me tonight. I hope that's okay as well. I'm sure that's a standard process. She's not doing a very good job today. She's having a bit of a cry. But in terms of how sort of CHC works, it's like a national framework that sort of gets set down to us to administer at sort of a local level. So it's a national framework, and I think that's referenced in the paper. And it's slightly a complicated process for people who aren't doing this in a day-to-day process. But what happens is, as people get identified for continuing healthcare, they have a checklist completed, which can be done by the local authority or by an NHS employee. And then we review that, and then they can go through to a full assessment for CHC. And the key points I wanted to land was there's absolutely a demand-led service in terms of people who need it. We put them through that process. And also the way that we assess for continuing healthcare isn't on diagnosis. So if someone has a health condition X and the same health condition Y, it's actually not assessed that way. It's assessed on needs in terms of what people's needs are. And the framework really clearly sets out, and I think it's referenced in the paper, around sort of what those criteria are about how we determine needs. And there is national benchmarking, so we're really highly scrutinised by NHS England. It's in the public domain as well, about how many people we put through the continuing healthcare process, and then how many people become eligible. And across London, so that's who we're currently benchmarked with, North Central London CCG is absolutely in the middle of the pack in terms of the people who get assessed for continuing healthcare and those people who go through to be actually fully eligible for us. So that's part of the process. I'm sure there's lots of areas people want to drill into, but just as a high level, as people's needs need assessed, we go through the process, we go through the framework that's set out by NHS England, and at the moment, in terms of our data, we're in the middle of the pack in terms of what happens across London. So more than happy for people to ask more specific questions, but that's just the highlight.
Thanks, Marisa. So I will ask a few more specific questions, basically because I've just sat through a few in my time as a councillor. I was requested to come in on those from residents. And I think this is a really interesting point you're making. So it's not diagnosis, but it's needs. And I think that can be very difficult on a checklist. And I wasn't sure, to be honest, when the person was doing the assessment, what their qualification was, if that's, whether they were a nurse, what medical background they had, what their sort of ability to actually assess what was sometimes very complex situations. So sometimes I think there was a propensity to tick a box without actually really understanding the need as a result of, and maybe sometimes relatives aren't particularly great, or and the person themselves, depending on how difficult it was for them to communicate how serious this need was. Because sometimes people are very good at saying, "Oh, I'm fine," or "Oh, don't bother, I'm okay." And actually, I'd be looking at them thinking, "Right, well, this is not what's actually happening here." But in front of somebody sort of in authority, there is that sort of, oh, don't worry, we'll cope situation. So I think sometimes without the medical diagnosis being particularly taken on board, because once you have a clinician saying this person has a stroke, they've got this level of severity, you've had the speech therapist coming in saying they can't swallow without assistance, you don't take on board all those sort of clinical details. It is down to that relative or the patient themselves, or client, because they're not in a hospital, to sort of try and get that across. And I actually found that quite a difficult process. And I was just an observer. I was not involved in the, obviously in this at all. So I think I'm just sort of asking, because you said we're in the middle of the pack. I'm just wondering, around the need for having an advocate or somebody there with the reasonable understanding of the system who can support the relative or the client through that process. Because having sat in on them, I'm not sure that I would say that those assessments were particularly, if I were done in a hospital, I think it would have been quite a different assessment done by a clinician as to the outcome of what boxes were ticked. So I'm just sort of asking now, I know you said it's all this framework and it's all the checklist but either, I think I'm just asking, is there an understanding that the person doing that checklist is quite well trained medically, so can I really actually get to the bottom of what's going on? Or can there be an advocate within that system who can, explain what's actually happening within that assessment? And I think that may solve a lot of issues that then happen down the line, and a lot of time is taken up following that sort of assessment process.
So I'm more than happy to answer, but Alison, do you want to come first, or you want to go off me?
Yeah, no, I was just going to explain that actually Whittington Health provide the assessors, so they don't sit where the money sits. So that is one of the great things about Haringey and Islington. There is some separation between clinical assessment and where the money sits. But I guess these assessors are experienced assessors, and they're doing this. This is their job. They're doing it all the time. So there is some consistencies. There's some national. There's training around it. Some national quality indicators that one has to meet in order to be able to do these assessments. But I guess the other thing around it is that every single assessment that is completed has to be quality checked. It's quality checked from our end, from our manager has to quality check each assessment, and then it goes through to the CCG. They have to quality check that assessment as well. And then what that assessment is a recommendation that is not only just that one assessor, that it has to be based on more than, it has to have a social worker there as a checker, or has to agree with the outcome of the assessment and contribute to the assessment, and there have to be a level of evidence in order to provide that a recommendation to the CCG. And then when it gets to the CCG, a person in the CCG has to look at the evidence and the recommendation rather than decision to say, is there enough evidence in this assessment to say whether they agree with the recommendation that's being made. There are other processes that are, you know, appeal processes, which Marissa, we could go into. There's local appeals that people can have, and then if people are not satisfied with that local appeal, then they can go up to NHS England and have an independent review of that decision. So, you know, it does feel that the system is fairly robust. I mean, it's not down to one person turning up one day and doing an assessment. I suppose that's what I'm trying to say. Marissa.
And I was just coming on the back of Chair's question about sort of advocates. So if an advocate's identified by their sort of nurse or social worker involved, or if people ask for an advocate, we do everything to ensure that people are supported through that process, and then an advocate is provided. That's the only other thing I'd mention on top of what Alison said.
Okay, thank you. I didn't know because that we were looking for an advocate, and I didn't know how to find an advocate for them, and they didn't know how to find an advocate. I'm just saying because obviously my experience is in a part of the borough where people are very able to ask, or more able maybe to ask, and know that this process happens. My concern is that there may be many other people out there that aren't as clued up, haven't got that information and wouldn't know. So I think it's really important when that very first approach is made, that offer of an advocate, especially if they feel that maybe they're not quite so familiar with this process, it would be really helpful if that was made at the outset to support that family through this process. I think that might sort of solve many problems later on down the line. But yeah, so that's, I'm going to open up to questions. Councillor Demir.
This is just for clarification for my purposes. Just as an example, let's say a patient is, does the patient have to request checks to be completed, or is it something that's done, well, based on, I guess, clinical advice, or, you know, how does that process work?
Chair, could you just repeat the question for me? I didn't hear it quite clearly.
Sorry, I'll project my voice, so it's a bit hard. So basically the question was, so how do people know that this service exists? Do they have to request it themselves?
So information is readily available on the website, and we're checked by NHS England to make sure it's standardised in terms of what is out there. Normally, as people go through a clinical process, the clinicians involved will notify that the next stage is to go through a continuing healthcare process. It's not something we sort of promote to people, as it's just a funding mechanism. The issue is about making sure that their care is provided, and there's a number of avenues for which this happens, and continuing healthcare is just technically a funding mechanism for which we put people through to make a decision about their ongoing needs. Jenny, do you want to come in?
Sorry, yeah, can we just have Councillor Demir asking you a follow-up, and then Jenny to sort of come in? Sorry, Councillor Demir.
Yeah, so I mean, the reason why I asked that, sorry, I'm shouting, so if my voice is quite loud, apologies. The reason why I asked it, I just used the example of my mother, for instance. English is not her first language. She had to go, and she has been into hospital for various reasons, and come back home, and she needed extra support. She would have no clue of, you know, something like the continuing healthcare checklist, and excuse me, and you know, Haringey, particularly, you know, the Tottenham end, is quite a diverse area. You know, we've got Turkish, Kurdish, African, Nigerian, Somali communities. So, you know, quite a diverse area. So I'd be interested to know, just based on not just the geographic location of people who are granted continuing healthcare or and have their checklist complete and then the assessment, but also just based on ethnicity as well, because I just imagine, you know, practically all my family members would have no clue to ask for a checklist to be completed unless there was an advocate that was put upon them, they wouldn't even know how to ask for an advocate.
Thank you.
Thanks. And yeah, sorry, just a quick one. They wouldn't, my mum doesn't even know how to use a computer, so there you go. Thanks, Julia.
Thank you. Is anyone able to, Marissa, are you able to respond to that? Did you hear that?
I think I did. So just to reflect back, what I heard was like as people go through the process, how would a service user know to sort of request this information, and then how do people sort of go on to be supported through the process? And in terms of what happens in the first stage, so any sort of social care worker or sort of nurse involved can checklist the patient, and then it goes through to a more full, robust assessment. So it's really for the service users, sort of care providers in that initial stage to be involved. And we've gotten much better. We used to try and assess people in hospital, which wasn't the best assessment place for continuing healthcare. So we tend to do it more in the community. We're actually mandated to do that now. So it's for the care professionals involved post-discharge. So go through that checklist process with someone who they think is involved in adult social care. And people are very aware in terms of community services, and Alison can probably support me on this, about people who might be suitable for continuing healthcare. And we have a process which we were talking about earlier in the meeting around Discharge to Assess, to allow people that time to get home, to be monitored, reviewed, and see if they actually need to go through this next sort of continuing healthcare process. We've got that 28 days national funding at the moment in place. And we sort of work with community services, and as Alison sort of said, that Whittington Health provides CHC as well as sort of the nursing services for us in Haringey, to make sure people are aware of that sort of checklist process, to make sure we pick up the people who need to go through the next steps. So I'm reasonably confident that we pick up most people. And as I sort of said, our national benchmarking that we go through with NHS England shows that our, what we call a conversion rate, are people that are referred to us and then go through to have fully funded continuing healthcare, is sort of in the middle of what London needs to see. So thank you for this question.
Yeah, so Marissa, so there was an important part of that. It was around the numbers within the east of the borough in different ethnic groups. So is there a breakdown? I know you said there's we're in the middle of the sort of table, but have you got any further detailed analysis of, whether people requesting this are, come all from one part of the borough compared to others, or different ethnic groups, or people second or third, English as a third language? What's your data on that?
Yeah, so that's a great question. So we flagged this up to NHS England to say that actually isn't a great ethnic sort of breakdown for continuing healthcare. And in terms of where people come from, in terms of wards, which I understand at this level is quite important, but I just wanted to reflect to you some of the numbers for continuing healthcare, because they are, like, I know there's lots of focus on continuing healthcare, but the number of people that actually go through are reasonably small. So the people who we have, just for you, so you have a feel for it in Haringey, and I don't think we put this in the paper, is across Haringey as of sort of June this year, we had 376 people on continuing healthcare. 77 of those were people who are fast-tracked, who are towards the end of life. 99 of those are funded nursing care, which just get a smaller proportion of the funding. And then we actually had 127 people underneath sort of physical disabilities, which is the way that we categorise it, but people obviously who needed fully funded nursing care, fully funded continuing healthcare, and then 13 underneath mental health, and 60 for learning disabilities. So the numbers are quite small. So we don't tend to do a breakdown to ward level. And I don't know if we physically can. I'm more than happy to take that away as a question. But the numbers across the borough, if you think of all the people in Haringey, largely underneath fully funded continuing healthcare for physical disabilities, is 127. So that's a small number, but I can go and see if we can get a breakdown by ward level.
Thank you. I think it's just really important as to Councillor Demir's point around whether people know. And I take your point that, you know, they might come up through, you know, the clinicians in the hospital referring them. But if they don't, then how do they access this if they don't know that this service exists? So that would be really helpful. Thank you. So I'm going to just quickly look around the panel. There's a last question on continuing healthcare. If not, we're going to move on to our next agenda item. And I'm going to thank everyone on the call that came in for this item. It was great that you came in. Yeah. Really helpful to hear from all of you. It gives us a very different feel. It's great to hear from our council officers, but it's really helpful to hear from the hospitals and the community, people out in the community actually doing the job. So thank you very much for coming on the call with us today. We're going to move on now to the next part of the agenda, which is agenda item 8. So that's the response to the Adults and Health Scrutiny Panel recommendations on day opportunities. And this has been, I think, I'm not sure, is it Tim who's going to be leading on this item? I've got him as the lead officer.
Not with us today.
Charlotte, excellent. Okay, thank you. So basically, this report was requested because, as I'm sure everyone's aware, we did a sort of day scrutiny panel recommendations on day opportunities, and this is the response, this is the follow-up to the response we had in October 2019. So you've got tables in front of you starting on page 25. You've got the recommendations, you've got the response from October, and then you've got the progress update from September 2021. So we're going to go through these. There's an opportunity for councillors to ask some follow-up questions on areas that I know they're very interested in. So apologies, my battery is running very low on my laptop, so I might lose you shortly, or you might lose me, but hopefully some of you will still, you'll at least be able to see the other panel members if they've got their laptops on. So we're going to start with Canning Crescent, which was one of the recommendations in the report. So this is well, Charlotte, do you want to say something briefly about Canning Crescent? I can summarise it, but I'm sure you're better placed to be fair.
I'm not sure about that, Connor. So Canning Crescent is a former a mental health clinic previously owned by Barnet, Enfield and Haringey Mental Health Trust. The council purchased it and have been working with a range of stakeholders to develop it as a new provision in the borough. We currently have contractors on site, and basically they're working to reshape the Canning Crescent into a new crisis cafe, which is a new provision in the borough, which is for people at risk of mental health crisis, a relocated Clarendon Recovery College, which is our sort of long-term in-house provision for people coming through mental illness, and the third element is to replace the recovery house, which is accommodation and to support people who are either at risk of admission or in the discharge arrangements for mental health. Councillor Ball, to your question earlier. So we're looking to ensure this is an integrated model. It's a really exciting delivery across Mental Health Trust and the council. Been working with service users. We've had one meeting with local residents, which we're looking to develop over the coming months. And I think, suffice to say, we're all really delighted by the opportunities this is presenting for an integrated site in the centre of the borough.
Okay, thank you, Charlotte. That's a really helpful update. So, Councillor Bull, did you have
That's not the moment, but give me 2 minutes and I will.
No, it's fine. You've lost your spot. No, I'm joking. Councillor Demir.
So I think when this happened, I wasn't on the panel. I have seen in the recommendation that it should be modelled on the Lake Clubhouse in Lambeth. So I've actually visited or used to work out of there quite often because I work in Lambeth with mental health. And yeah, it's a brilliant service. And I'm not sure if you've been to yourself, Charlotte, but I just found it, because it's so heavy on user involvement, whether it's the cafe, activities and things like that. It's not just keeping people, busy, but it's therapeutic as well, because they were all kind of together and the staff members there were brilliant. So I'm really happy with that. Thank you.
Yeah, thank you. We did look at a number of settings. Lambeth was one, Oldham was another, and another setting, I think, in the Midlands, which we sort of looked at different models. We've had users involved from both Clarendon Recovery College and from the current recovery house, and so we've been working with them on modelling for the future. So I think we are looking to models elsewhere, but also trying to respond to what users are saying is important to them locally. But yeah, Lambeth, I think, stands out as a really strong example.
Sorry, Charlotte, can I just be clear? Because I think at the time you said that you weren't going to use the model by the Mosaic Clubhouse. You were looking at other models. So are you saying now that is that still in the mix?
Well, I think the model of the clubhouse, as Councillor Demir sort of suggested, is a mixed model which responds to service user need, and which is about both avoiding admission, supporting discharge, and making sure that people are supported to live in the community as safely and for as long as possible with the right supports. As Councillor Demir indicated, that is, we need a model that works for Haringey, but I suppose you can't lift a model out of one borough and into another, but I suppose it's got elements of what's in Lambeth, and I think we've always said that we'll look to best practice elsewhere, but also look to developing best practice in the borough.
Okay, so is that including, so you're saying about the co-production bit that you're doing? You mentioned that you've had one meeting with local residents. Is there any other co-production going on with any other service users at the moment?
Yeah, so there's, I think, sorry if that didn't come across, but yeah, absolutely, with the current users of the Clarendon Recovery College, with the users from the Recovery House, so a group of users are working with clinicians and practitioners to develop the model. So yes, absolutely. Okay,
thank you. Councillor Peacock.
Charlotte, I'm going to reflect on the 684 the High Road. Do you remember that place? It was exactly the same as what you're proposing to do at Canning Crescent. It was a facility for a drop-in centre for people with mental health. They had cookery lessons there, they had gardening lessons there, they had artistic stuff there. Everything was going strong for that. And then it was closed down and the people were left bereft. And they were just wandering around the street.
Sorry, Chair, is that in Northampton Park?
It's on Argyle Passage, which is between Northampton Park and Tottenham Hale.
Yeah, I do know this.
And after that, people were just walking through the streets and not knowing what to do or where to go. And a lot of them didn't have any money and therefore could not go to Woodgreen, to the facilities that were there. I certainly hope that this doesn't happen in Canning Crescent, that suddenly it all goes pear-shaped and it collapses. Because I'm really concerned. I'm sorry to say this, but I really feel that Tottenham's lost out. A lot of these people with the mental health problems are in the Tottenham area, and they lost out bitterly when that place is closed down, and it's closed down suddenly with no thought for the people that were there. I'm sorry if I sound very bitter, but I am, because I used to go there a lot, because I used to walk past it every single day. And I'm just hope I'd like to see Canning Crescent and see if it offers the same facilities that this other one did. It was an excellent service.
Well, thank you, Councillor Peacock, and that is a salutary tale, I think, of why we need such provisions really in our local communities that are inclusive and that offer meaningful occupations for people with mental health needs. So thank you. And we're gathering in money from NHS England. This is a jointly funded project across the NHS and local authorities. So this is and delivered by the Trust and the Council. So we think it's a sustainable model going forward. But yeah, take your point about sort of whether there's demand elsewhere in the borough, and certainly we're hoping for it to be accessible. That's partly why we've chosen Canning Crescent, which has got very good transport links and is accessible across the borough. So thank you. I think it is, we need to be mindful that we've got the right provision for people with mental health needs across the borough at different levels.
As I'm trying to say, it's very difficult for people with literally no money to get there, to get to Wood Green. There's no facility at all in Tottenham.
So is that the question you're asking, Charlotte, about the provision of mental health
How are they going to get from
services?
Tottenham to Wood Green? They're just direct. It's all very well having a really nice place in Wood Green, but it doesn't help the people in Tottenham.
Well, I think what we're trying to do is to have a borough-wide offer that is more central than anything we've had before. The Crisis Cafe is a new provision. It's actually an additional provision in the borough that is accessible. We'd certainly be looking with local residents about access and making sure the transport is included and they are able to travel to the provision. We're certainly constantly looking at demand and what we need to provide locally, trying to make sure that our other provisions in the community are accessible and inclusive of people with mental health needs. So certainly we haven't identified that there's a particular gap, but certainly thanks for your response, and we'll certainly constantly reviewing what we have in the borough. This, as I say, is an additional. It brings us additionality in terms of offer in the borough. Sorry, Councillor Dustnev's got a hand up as well.
I sort of see the point, but there was a cafe there that did provide hot meals and that, and so a lot of these people then eventually found themselves at the Irish Centre and used to come to lunch and club there. And so I used to visit the Irish Centre a lot, so I'd see the same people either wandering around the street looking for somewhere to have a reasonable meal, and if I could, I would point them in the direction of the Irish Centre. And as you know, that was only Monday, Wednesday and Friday, so goodness only knows what they ate in the other days. It's very sad.
So, Councillor Snebs, sorry, my computer's now gone down, so I'm now reliant on other people to tell me what's going on. Yeah. You're too far away. So, Councillor Snebs, you've got your hand up, I think.
Thank you. Thanks, Councillor Connor. Thanks, Chair. And thanks, Councillor Peacock. That's really useful feedback. I think one of the things that we need to bear in mind is one of the services that we're going to relocate there is currently based in the west of the borough. So actually we'll be able to provide greater bedded spaces somewhere that's much more accessible. And I think that will certainly be useful. I think it's useful feedback to look at what other provision we have in other parts of the borough and review that. Canning Crescent's been a project that's been in, I suppose, inception and production for some time now, so we've given a lot of thought and a lot of input in from users. I'm not sure when the service that you're describing was closed, and it certainly sounds like a very sudden and awful cut to a service that people were using, and that's certainly not something that we would want to see repeated. But of course, us partnering with the local mental health trust and looking at sustainability of funding in that way should help make sure that that doesn't happen, and we're fully committed to providing that service.
But it is happening. It is happening. It's happening in Clarendon Road. You're going to pull that down, and the people from Clarendon Road have been relocated to Canning Crescent. So you're losing that facility there.
So, sorry, Councillor Snowes, is there something that we maybe discussed in the Cabinet question time and maybe about the locality? Because we're looking at the locality working, aren't we, and the new provision of different services in sort of the Northumberland Park area and others in that part of the borough. Is that a conversation that you would like to take at that point, or would you like to just answer that at that point now about Clarendon?
Quite happy to discuss now and pick up a bit later as well. Certainly our localities-based approach to working will see us think about what services we need where people are, so that's useful. I think we've worked in partnership with Clarendon Recovery College, and I think perhaps officers can come in a bit with what the view is from that service and what they've said about the move. We're certainly not foisting or forcing anything on organisations within the borough providing services. I think that it's important to note that the building that in Canning Crescent will provide a very therapeutic space for people and has a good level of space and a good level of interaction between different services. So we'll have staff there at all times, and I think provides a good option for people who need it
Yeah, if I can come in as well, thank you, Councillor Dusnevs, on the Clarendon Recovery College. We're working, Clarendon Recovery College is absolutely a partner in this, so shaping the provision with their users, and the idea is that it moves, we don't lose Clarendon Recovery College, it moves more centrally, it is able to link in better with other services, we get the clinical and therapeutic inputs that Councillor Dusnevs has highlighted, so it should be an additional benefit to the Clarendon Recovery College, and they're very excited both from a professionals and from the users, and in fact we had one of the users at the community group who spoke very passionately about the opportunities that he saw from moving into this sort of expanded provision at Canning Crescent.
Okay, well, in the interest, we've got quite a few recommendations to get through and to discuss. I will note that Councillor Peacock is still, I would say, unsure about the provision in Northumberland Park area, aren't you, on that? So I think we'll leave that at that point. We'll go to Councillor Bull, and then we're going to move on to number 2, which is the Woolworth Gardens.
Oh, that's fine. My question was on that, but just one. My camera. Just one observation, and it's about, and maybe the cabinet member one will pick this up during cabinet member questions on it. But it would be good to know where we are, if we are anywhere, what should be happening, which is the mental health strategy. We talk a lot about putting investment into putting preventative measures in place to deal with people that have physical frailties. But so much of what mental health patients experience is probably down to central government policies in terms of the state of the economy, dependence on alcohol. But that doesn't mean to say we should wring our hands as a local authority. So there's nothing to do with us. We can't do anything about it. Let's all blame the government, because it doesn't really matter who's in power. These issues still present themselves in one way or another. So what I'd quite like to see somewhere is a recognition of the importance of putting in investment into those preventative measures, understanding quite simply what are the 5. This is where you come in. Because you were Southland and Maudsley. It's a mental health trust, isn't it? You said that, yeah. Surely there must be an analysis done of what the top 5 causes of mental health problems across the country: alcohol use, financial dependency, financial problem, blah, 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 blah. And we should be trying to do something to address that as a local authority, so that we don't have to have the level of mental health provision that we have at the moment. We can scale back on it because we're putting the money in at a preventative level. Am I making sense with what I'm saying? Or does it just sound like a vulgar?
No, I'm sure Charlotte's ready to jump in, or Beverly. I can see.
Yeah. I mean, absolutely, Councillor Bull. I think prevention and having a mentally healthy environment to grow up in, to live in, to have good quality of life experience, to have access to employment and education, good quality housing, all those things are absolutely factors that reduce the strain on households and pressures and on individuals and support good mental health and well-being. And I think we've seen that absolutely through the pandemic, with a real sort of the additional strain of that has really sort of affected people's mental well-being going forward. So completely agree that those wider preventative approaches, how people access parks and open spaces, how they experience their day-to-day lives is absolutely fundamental. So couldn't agree more. And I think that's part of having community-facing initiatives such as this one that aren't about a clinical response first off. It's not about going into a hospital setting. It is about how people are supported in their local area. So yeah, completely agree. Hand over to Beverly.
So Beverly, if you could come in briefly on that, and then we're going to carry on with the recommendations.
Yeah, just very briefly, just to support what Councillor Bull has said is around that focus on early intervention and prevention. And just to say that we were recently very successful in what a bid for the Great Mental Health Fund, which is going to do exactly that. Public health team were able to attract over 300k to have that focus on that sort of wider community mental health. So we would be happy to report back to you how that progress is going forward. Thank you.
Thank you. That's really helpful to know. It's always good to know when we have more money coming in for other proposals. We are on recommendation number 2 now, which was when the 3 former day centres. So there's been some excellent work on the Chad Gordon Autism Campus. I know, Councillor Bull, you had a question on that, didn't you? So do you want to start and then, yeah.
Well, I suppose I'm not going to say too much about, previous decisions about closing daycare centres and those people that believe in the value, the price of everything, the value of nothing. And I'm glad that this administration, previously under Councillor Ejiofor, now under Councillor Ahmed, and we've got an excellent cabinet member in Councillor Desnevis who's continuing the work of both Councillor James and Councillor Ahmed. There is a definite recognition of the importance of building space and care. There was a previous political direction that said, oh, we'll just give the money to the service users and they go and buy their own care. That's a nonsense. Absolute nonsense. Absolute nonsense. And it's been proven to be a nonsense. And the fact that we're now going ahead with the Chad Gordon existing campus is a really good step forward. I suppose my question is that what next? What more can we do to because I tell you what, colleagues, and I'm going to shut up here. What I really want to see on Moorfield Gardens, the first thing I want to see is that ridiculous idea that's on the agenda somewhere of building housing on there should be kicked out completely, because it should never have been put on the agenda in the first place. How you can tell residents that you're going to build an adult social care centre and then that site is still allocated possible housing is a nonsense. But I will take that up with housing officers elsewhere. Colleagues, adult social care colleagues, what I really want to see is the CAB building pulled down, because it shouldn't be there for as long as it is, because it's the old Lordship Lane Health Centre, primary care centre, before they built the one at Lordship Lane. That to be removed, and for that whole set site to be a health and social care campus with the dentist at its beginning and adult social care. I know this is not questions, it's never not a speech. The question is that now, I don't want to open up the debate about the Haven. What are we doing for older residents in terms of daycare provision? We're doing lots for people with learning difficulties and mental health, which I think is really, really important. Can I just hear a little bit about what we are doing in terms of daycare provision for residents with physical frailty? Please don't tell me that they're all going to the Cypriot Centre, because I wouldn't believe that, I'm afraid. So what else are we doing? Just remind me, because I've dropped off the agenda a little bit on social care, but I'm back with a vengeance now. Thank you.
Do you want to kick off, Beverly?
Yeah, I'll kick off and others can come in. So, Councillor Bull, you'll be familiar with the Winkfield Resource Centre. You're talking about physical disabilities. We now have Disability Action Haringey very much based there, supporting people with disabilities. Councillor Desneves and I were there, I think, just a couple of weeks ago. It was really encouraging to see the range of services for people with physical disabilities, quite a purpose-built provision that supports the sort of development of independent living skills for individuals with physical disabilities. So the Phoenix organisation operates from there in terms of that sort of sensory impairment, etc., etc. So Winkfield Resource is very much part of the sort of the whole community provision that's run under our directorate for people with physical disabilities. I don't know if you want to add anything more to that, Charlotte.
Thank you. I guess on older people, we've had several older people not wanting to access day provision over the pandemic. Clearly, elsewhere on the table, you'll see the Aging Well guide, and we've been doing a lot of work through the Age Well partnership approach to develop a range of options for older people, including sort of from low level support through to higher level support. I know you've had a visit to the Grace Centre, so thinking about the Opera in the East, we've been expanding the Haynes day provision in the West in terms of dementia care, and we are. I mean, I think you're right. We're looking to revitalise the opportunities working group and think about next steps around older people. But I know there's a meeting with providers this week, and we're doing it very well very much under the aegis of the Aging Well strategy, and making sure that we're linking in with health partners, with the voluntary community sector, and across other parts of the council. I think we've seen some really lovely work at Bruce Castle Museum around reminiscencing and dementia care. We've got the Thrive London funding in, which links Jackson's Lane, again, Bruce Castle Museum, and the council in supporting older people with dementia. And we've got some really good initiatives to sort of cement for things like libraries and the home library service, the offers for older people that are more varied than they were previously. So it's a range of things. It does include the Cypriot day provision as one of our providers, but it's one amongst many. And what we've tried to do through the Aging Well Guide is make sure that that broad swathe of an offer is reflected.
So what did they used to do at Winfield? Sorry, I'll ask you.
It's always been the same.
I didn't think it's always been difficult. I don't know that. I thought
I'm blind.
Right,
I'm
big
blind.
problem. That's good. I didn't realise that. Thank you.
Sorry, too.
Oh, actually. Rory? Yeah.
So I'm just going to ask a quick follow-up question on Councillor Bull's question on I know we're still on number 2, but actually this does hit on the capital funding as well. So we've got the Hames, and you mentioned about expanding dementia care services, but I'm just wondering where the centre, where the council centre is. So I know it's the Hames in the west of the borough. I know exactly where to go. I know who to refer to. I'm not 100% sure of our specialist dementia centre in the east of the borough. Yeah. So,
that's right, yeah.
Yeah. So I know it was previously. I'm just sort of, I'm just wondering if there's a plan for, in the same way we've got the Hames in the west, we have something in the east. So I know we've got lots of different services in the community, Charlotte, which you've very eloquently sort of brought to our attention. But it's just, you know, it's the Hames in the east. What's happening in respect to that? Because that was part of our recommendation on the second one, which obviously I know.
Yeah, and that was very much in our sort of framework approach, the sort of 3-tier approach around the opportunities, is to consider what our centre of excellence is in the east around older people's services. So we're still working through that. Obviously, with the pandemic, we've had a complete sort of pause on a number of those areas, but we are revisiting that now to consider what that looks like. What does the locality model around that look like? Now we're here and just thinking about that in relation to a number of providers. So I don't have an answer for that at this moment, Chair, but we can come back to you at a future panel around older people's provision.
Okay, thank you. So I think sort of one of the recommendations from the panel this evening will probably be around, a greater understanding of an area of excellence in the east for dementia care, as we do have in the west with Hames. I think that would be really helpful for the panel to sort of have some further information on, obviously, when it's available. So we'll move on to number 3, which is the service provided by reopened centres should be used as a wider community offer. So I noticed you've got this is very much part of our planning. So I'm just asking, is this actually taking place? I mean, obviously through the pandemic, everything's closed. Everything's beginning to reopen now, but what's your sort of thoughts around, is there a structure, are there managers in place to actually do this? Or is this a drawing board sort of, as in it would be nice to do, but we've got other things that are prioritised?
Yeah, so one of the roles we've recruited to as part of the Chad Gordon Autism Campus is an activities coordinator. I may not have got exactly the job title right, but that is precisely to broker the use of that space when it's not being used, to make sure we've got those effective links with the communities. One of the things, obviously, with the support and input of the co-design group was about making sure the spaces were autism friendly and were designed with the right lighting, colour tone, flow through the building. So they are an asset to be used by other groups who are particularly interested in that nature of design. So that is very much part of the work that they're doing. The campus launched in mid-August, very much sort of settling in post-pandemic as people get used to being back in community provision. But absolutely, we want it both to be outward-looking and for members of the community to feel that they can use those spaces with those design standards in place. Councillor Destno. So.
Thanks, Charlotte, and thanks, Chair. I think you're absolutely right, Chair, that when we have a space, we should be looking at how we fully use it and how we connect with the community. So, for instance, with the project in Canning Crescent that we've talked about, very much the Crisis Cafe there is an open space, and we're hoping that we will break down some of the barriers and boundaries that we have in the community, and that anyone can come in and be part of that space. And I think each time we look at a venue like that, we should be looking at the different, depending on what services are there, how the community might well be able to be welcomed in and might well be able to use the spaces. So I guess what I'm saying is, well, that's a commitment from us always to think that through when we're looking at a new opportunity in a new space.
Okay, that's really good to hear, because that's, we don't want to lose that. Councillor Peacock, you wanted to ask a follow-up.
I just wondered, Charlotte, if you've ever been to Prothero House, the extra care home, which provides everything you're just saying, but perhaps we should be linking in with them. I go there nearly every week. They have a person who does all sorts of entertainment for the people there. They have art and all sorts of things going on there. And also people coming in to speak to them on various topics. It's a very good facility, and it's in Tottenham. So perhaps you could link in with them, or Lorenco House, which again is another facility that I go to quite often.
Yeah.
Because for some reason they seem to like me and they invite me to all their functions.
Thank you, Councillor Peacock. Yes, we work closely with One Housing Group. We're in regular monthly meetings with them, strategically thinking about how we make sure we make best use of each other's resources. So absolutely, Prothero and Lorenco, and obviously the proximity of Lorenco to the Irish Centre and possible, the possible Grace relocations, some real benefits there for that cross-working, and certainly Prothero House as well, which again has fantastic facilities, the community cafe, the space, the kitchen. So yeah, we're very linked in with those, and I think that's part of our sort of work, and we've seen it in the planning around Osborne Grove, is to open up spaces so those residential settings, whilst they feel safe and secure for residents, don't feel like they're cut off from the rest of the community. So I think that's a point well made, Councillor Peacock. Thank you.
Well, Alice and I used to walk a group from the Lorenco House to the Irish Centre on Friday for dinner. We used to take about 10 people from the Lorenco House to the Irish Centre.
No, I think that's those sorts of things just make such a difference, don't they, and really sort of cement those relationships. So yeah, really important.
And that brings us nicely on to capital allocation on recommendation 4. Around
Councillor Connor, you may not be able to see Councillor Dasnerv's hand. I'm not sure what you can and can't see. So,
do you want to come in at this point?
Yes, I just wanted to say that, Sheila, you might be really pleased to hear that I've got a visit planned. I'm doing a range of visits to all the services, and I've got a visit planned to Prothero House. So I'll be able to see it firsthand and look at the very things that you're raising. So I'm really glad that you brought that up. So thank you.
Named after Archie Prothero, who was the last mayor of Tottenham, and he was a milkman in that area. And I made sure that his name continued on that building when they rebuilt it.
Okay,
fabulous. Thank you.
Peacock with you is what I'm just thinking.
Very happy to.
So I think the idea that Councillor Peacock raised about using their expertise, because obviously they're doing it really well, and obviously within their own building. But if we're looking possibly, and we'll come on to the Irish Centre, the Grace Centre later, but I think it's around having, knowledge of how to run those after hours groups. If we're doing a day centre, then the managers will go home when that time finishes. I would assume, when the last person leaves at 5 o'clock, it's who then comes in to take actually over the running of that and make sure that everything works well, and that all the the catering, whatever else is happening in that facility, or the meetings that residents are using it for work. So I think it's really how that's funded, who coordinates it, and a myriad of other lots of questions which we won't go into detail now, but I think that's quite a complicated. I don't think it's as easy as it sounds, is what I'm trying to say, and I think somebody would need to sort of lead on that in order to make sure that effectively Prothero House and Lorenco House, obviously if they're doing it, they may well be able to sort of give us some, assistance in that.
And I think that is why we've recruited, and it's one of the people we've directly employed as the council, that role at on the Chad Gordon Autism Campus, just for that very reason, that we think it's so critical to have in place. So yeah, thanks for that.
Okay, so we're going on to the capital allocation around day centres. And I think it's really just to understand whether the day centres that or centres that the council owns and the council is sort of responsible for, do we have sort of how is the joined up approach happening between people doing the day centres, the capital that they think that might be needed to do the upkeep of the buildings? So is there a sort of really easy communication going between the housing team? Councillor Bull, you were talking about this earlier. Is it the housing, you were saying, team and the actual day centres? And you were saying there's sometimes the communication between the two, and you weren't sure when it was a haven.
Is this when the building was with property?
So yeah, so is it sort of, does it have a property aspect to it? And if so, who's taking the lead on that, wasn't it? So it was
originally a community centre.
We're talking about the haven.
No, so it's using the haven, but actually all day centres the council owns. How do we make sure that those?
So my question, Beverly and Charlotte, was around. So you know that I've got a very active resident association on Tower Garden Estate, which Moorfield Gardens comes into. When in between the haven closing and it becoming the Chadbourne Autistic Centre, it was the responsibility of corporate property to manage the building, with the overgrown foliage and all this, that and the other. Now that it's under adult social services remit, who's responsible for the outside maintenance of the building and the site? Is it down to social services or is it down to property? And that lends itself to other community buildings that we have that come into one directorate. Is it the responsibility of that directorate to maintain, or is it the responsibility of the main property development director under Bill Ogden, I think it would be?
Yeah, so thanks for that. I mean, there's a number of different things around the building. So there's regular maintenance, which sits with corporate landlord. There's the external sort of maintenance of the grounds, which we're involved in. We've certainly got some work, and one of the activities that was raised earlier was about how do we get users who want to be involved in gardening to support that sort of maintenance of the ground. But we work with our colleagues in parks on that as well, and environment. So it's fair to say it's a sort of coordinating role as holding the building, and then any capital required for enhancement works, if there was to be any sort of significant change to the design of the building, that would sit with major works. So it's fair to say we have to link in with a number of different parts in the council to make sure we've got the right supports into the building, and that's true of any building. So the sort of statutory compliance, the regular maintenance, the programme of sort of things like checking gutters and drains and things sit with corporate landlord. The sort of more expansive capital works like at Canning Crescent sit with capital projects and major works, and we just sort of need to coordinate with our colleagues within that whole directorate support. So yeah, it's and that's how we get the benefits that we need from the expertise that is across the council. So we use colleagues in parks and environment, but as I said, we're very, very keen, and I know the manager at Chad Gordon is really keen that we engage service users in that sort of therapeutic activity of gardening, and there's some real interest in that happening for the campus.
Charlotte, that would be a really good idea, because I know the Parks Department are miles behind because of COVID. Actually, Brexit, we lost some officers in Parks Department because they've been released from the European infection. Couldn't stay. I know I was working with the NHS, and we had you as well. We were told carry over more annual leave than we usually do, and so now there's staff that have to take additional portion of that annual leave. So the Parks Department are really struggling. So anything that service users can do to help with gardening would be excellent. So that's it. Because I know there's quite a lot of important.
Yes. Well, it's just to make sure everyone's got there. So okay, so thank you. So I think from your answer, Charlotte, that was quite a large amount of people involved. And I'm just asking you, who actually heads that team up? Would it just be, is it adults because, that's their building now and everything else comes into it, or would it depend on what was happening at the time?
So we rely, I mean, basically all the people I've mentioned sit within housing, planning and regeneration, so the sort of property side of the council, that sort of holds our assets, and we work alongside them in a very collegiate way. So we have a sort of maintenance budget allocated, and then we work with them when we need it. So they don't sit within adults and health, but we link across with them. That's how it works.
No, I'm just wondering who's leading on it. So if there was an issue, who would lead? But it sounds like it's a joint partnership approach between
So there's a regular program of maintenance. So for example, corporate landlord, there are statutory assessments, compliance assessments that need to be done, like fire risk assessment or electrical checks. So they'll be on the program of corporate landlord to do, and then they'll liaise with us at the points at which they need to gain entry to do those checks, for example.
Okay, thank you. So we're on to number 6. So to provide more support to service providers on how they can demonstrate social value. How is social value going? Because I know we were looking at this as part of our commissioning scrutiny, and the difficulties in actually defining what social value meant and then how to add the value onto that. And then the final bit was how to measure whether the social value was actually occurring within the different projects.
Councillor Smith, do you want to come in first on that one? Sorry. You're on mute.
Apologies. Rookie error. I'll come in, and Charlotte, I might cover some things, but it's my understanding that the Bridge Renewal do quite a lot of work with our organisations in the borough, supporting them looking at social value. And it's definitely a learning journey, I think, for many organisations. And I know we've certainly been through quite a lot of work when we think about how we commission as to how we can enable organisations to show the impact that they have in the borough. I think it's something that we should continue and will continue to evolve and evolve our support for as well.
Okay, thank you. Anything further, Charlotte, from all the work that you were doing on social value before?
Yeah, I mean, I think we're continuing to work with a range of organisations. We've got a sort of matrix that we use for the local area coordinator model to evaluate that around social value. It's linked into our sort of community buildings assessment. So really key. And obviously there is an act that we've got statutory duty around social value. It's one of the few areas of social policy which is supported by legislation. So, as part of our procurement, any commissioning, we need to take into account social value. We've taken a really public health approach to that in terms of things like social isolation, local employment, health and wellbeing, impact on mental health, environment and sustainability. So really trying to look across the whole swathe of things that make a difference, a bit to Councillor Ball's question earlier around sort of prevention and early intervention.
Okay, so just to be really clear, so social value, do we actually have a sort of a defined what we mean in Harringay by this as part of the procurement process, or is it dependent on each project? You'll look at it and pull in different areas that you think, or what I'm trying to work out is how this definition is arrived at. Is it officers coming together thinking, well, this is what we should be doing, or are we looking at it from a resident's perspective on what they think social value should be?
So we have got something attached to the previous community buildings review. Obviously, that's quite outdated now on one level. So the work we've been doing, which Councillor Dusnev's highlighted, which Bridge Renewal Trust we're doing with Bridge Renewal Trust and a range of other community organisations, is about trying to sort of update that and take into account a wider set of considerations. So absolutely, that's that ongoing piece of work which Councillor Dusnev. So there is something. But I have to say we're constantly needing to refine it, and we're looking at as part of our procurement approaches, how we develop community wealth building. There are a number of areas where we're sort of reflecting social value. Certainly, I think it'd be part of the new borough plan. But back to Councillor Dusnev.
Okay.
Yeah, Councillor Dusnev. Oh, sorry. Somebody said that Bill Morris might have had his hand up, but I can't see from here. So.
No, he's not.
There was something came up on his face.
All right, Councillor Dusnev, over to you.
Thanks. I just wanted to mention something that I was going to mention later on when we talk about when I did cabinet member questions, which was really that one of the other things that we've been talking a lot about is how we engage users, people using our services and residents in monitoring and having input in the monitoring and the commissioning of services. And I think that connects to social value very strongly in the sense that we want to be, speaks to your point really, which is that we want to be thinking about a service, thinking about what people are experiencing from a resident or service user or person with lived experiences viewpoint, rather than from the necessarily our own kind of perspective as just a commissioner. So I think that's certainly something we've been discussing since I've come into the post.
Okay, thank you. So I think watch this space is the what looks a bit in the box there. We've got recommendation 7 to give reduction of social isolation strong consideration, and I think you've got as previous update. So it's included and considers it falls within the health and wellbeing domain. Is there anything else we want to say at this point around social isolation?
I suppose the only thing to add is it's been brought into sharp relief, and many more people have experienced it during the pandemic, which I'm sure we all recognise. But I suppose it's a very present reality for a number of our residents, and a number of whom are still affected by anxiety about leaving the home and getting into sort of social situations. So just recognition of the greater importance that we're seeing on addressing social isolation in sensitive and sympathetic ways.
Okay, thank you. We've got transport links, number 8, so that people could get to service users could access support in the part of the borough that they lived in and didn't need to travel long distances.
Yeah, so I mean, transport links absolutely sort of enabling people to get to provisions. They're having provision if they can't travel to it. So absolutely supporting in a variety of ways people to get to their settings, whether that's through provision of transport, whether that's support with buddying and mentoring systems to get people accessing, but also that idea of things being as local as possible and in settings that are as neighbourly as possible. So just picking up the points that were made earlier around the importance of local provision.
So, and that leads us on to recommendation 9, and you say at the very end of that we don't tend to advertise our transport offer and go on a case-by-case basis. Why don't we sort of tell people what we're offering, or what's the rationale behind that? I know it varies depending on what that person's assessed need, but the bit I'm just a bit concerned about is when they have their very first assessment, do we actually tell them there are these range of different transport offers?
Yeah, I mean, I don't think it means we don't. I don't know if that's come across wrongly, as it were. So it's not saying that we don't let people know. And I don't know if Jenny would want to come in from a sort of assessment perspective on, or Beverly on sort of how that's managed within the assessment process. But absolutely, it's that core element of understanding what people need, and then if one of the outcomes is that travel to a provision, how do we enable it? Jenny, I don't know if you want to come in.
Yeah, absolutely. I mean, the idea of the care and support plans is part of that is we have to make sure that people can actually receive the care and support that we think is in place. So it is something that would be considered and included in the care and support plan if it's required.
Okay, thanks, Jenny. I just know there's always emails to councils about transport for residents, so it's one of those things that is always on our casework. So I was just checking how they were informed about what their offer was. But if you're saying that happens at the outset and they're fully aware of all the different offers, then that's reassuring to hear. I'm just going to take your silence as a yes on that, or that either you can't hear me. So
yeah, no, sorry, I was nodding, but I realise you can't see me. Sorry, apologies. Yes, absolutely. Thank you, Councillor Connor. That's it.
Okay. Number 10, to redesign the Harry Care website. I have to say I went on this today and it was still telling me that I go to the Irish Centre, which, having just been on a visit there at the Grace, I know is not actually quite true. So the Harry Care website, what are we doing with this? Because this seems to be every single year we discuss this at Scrutiny. Surely somebody somewhere must just decide that actually we need to, you know, do something different. Is that happening, or are we persisting in the Harry Care offer on information?
Yeah, I mean, I think it is important around sort of information, advice and guidance. Elsewhere in that table, we highlight the link to the Ageing Well Guide, and I think we are moving increasingly to those much more sort of responsive and flexible guides. But it is a useful setting, but it does rely on people updating the information. So, you know, we've got a limited resource to enable us to do that across the whole swathe of things that are covered in Harry Care. But we are reviewing our information, advice and guidance offer, and we'll be looking at exactly how that works. I mean, what's highlighted in the table is the way we've managed to convey information during the pandemic has sort of shifted our thinking around targeted information campaigns, how we use social media. But obviously that doesn't work for every cohort, and just really mindful of making sure we've got the information in the right media for our various residents. So really important around things like language, accessibility, font size, whether people can use online resources. So yeah, that's all part of the work we're doing to review our information, advice and guidance. I'll about hand over to Councillor Desnett.
Thank you. Councillor Desnett.
Thanks, Charlotte, and thanks, Chair. Yeah, I mean, I think it's actually really important that I think thinking's moved on a lot on how you provide information to people. And one of the things we've talked about in our Ageing Well guidance is around having users' feedback. So taking what's called now a content design approach. So users' feedback and say how they want to receive and what they think of how you're providing information to them. And I think you're spot on. We need to be thinking really carefully about when delivering up. And I think you and I, Chair, have had a conversation before about delivering up the right information at the right time in the right format. So I think that's absolutely a priority. And as we review that whole service around information, advice and guidance, it's thinking, well, what have we learned from the pandemic and what's worked well and what can we do more on? And also through Ageing Well, for instance, we've started with some information and we've committed to having input from users around what they think about how they're receiving that info and how could we do it better.
Thank you. That's good to hear, actually, because communication is key, I think. And the connected communities, I think, worked incredibly well during the pandemic. I think that was one of the things that everyone kept saying how great it was just to be able to phone up and actually get some information from the voice at the other end who they didn't know they'd find out, and you know, it worked incredibly well. So I'm hopeful that there'll be another iteration of the next iteration will be coming forward. I think we can do it. It's just resourcing it and you know and identifying the need.
And one of the things we've sort of invested in is NavNet, which is basically all the practitioners who are working frontline and on the ground coming together to share information, to ensure that they know who to contact if they're stuck about information. So building relationships which enable information giving to residents. So I think that's an important, you know, it's no one part of the system that needs to have that access to that information at their fingertips, knowing what's current and what's not. So, but I think that's then how that translates to residents. So I think we are building different ways, but we probably need a bit of an overview that helps everything to connect so people aren't just relying on one source. So point completely taken about Harry Care, and we'll come back to you on that sort of wider model.
Thank you. Because I also like number 11, which is the Preparing for Adulthood Pathway Guide, which I keep saying is exemplary, and it's one of my favourite things that Harry Care has ever produced. And I wish there were more of. And I know it's a partial agreement, because there was other ways of looking to how to deliver that information around the coordinator offer, and how they're going to, which Charlotte you've just described. So we won't reiterate that, but I'm hugely supportive of that booklet, because I think it gives people a chance to go away and just read and think in their own home, and you know, and then they can come back, look at it again, come back, look at it again. Because we all know that when we're getting information for the first time, we need to read things about 7 times before we can begin to absorb if it's a stressful situation about needing care for a relative or somebody close to you. So we'll move on to number 12, the use of area coordinators and.
Councillor Connor, Councillor Desneves has her hand up again. Apologies, Chair, just to intervene before you move on.
Wave your hand. Sorry, that's.
Sorry, I have to shout next time. I have to shout. I keep forgetting. I just wanted to say that Councillor Brabazon and I are scheduled to meet to talk about that transitions, to talk about what happens between services, and I think actually thinking about the information we provide to people and at what point and in what format is an important part of that conversation too. So I just wanted to put that there, that conversation is taking place.
Brilliant. So you've got the local area coordinators and the NavNet, which Charlotte's just mentioned. So that looks like that's going to be really interesting, and the sharing of information. I think, hopefully that'll all go really well, and I'm sure we'll get some further updates. Councillor Peacock, you've got a question on that.
About the dementia care navigators, I'd like to know more about it, because I walk someone with dementia every morning, take them for a walk every morning, and I didn't know about this dementia care navigator, so I'd be interested to know more about it.
So we've got a number of navigators in place to help support people through the system. Some are focused on dementia. I think what we found is also through the pandemic, they're having more generic navigators, so connected communities, the sort of wider points around reach and connect, trying to make sure that everybody has those skills so that we're not relying on a small number. So happy to pick up if you've got a case, Councillor Peacock, that we could pick up an individual response to outside the meeting.
Do you mean, Councillor Peacock, how a member of the public would just know that a dementia navigator exists? Yeah. So what are we doing to just make, just promote that? Are we going to GP services? I know people aren't going in person at the moment, but
yeah. I mean, I think the Ageing Well guide that we've put there is specifically focused on what resources are available currently for older people. So I think that's our sort of route at the moment, specifically around older people, to promote the sort of most accessible form of support. Councillor Desneves, I'm going to hand over.
Yes, I've just seen it.
Yeah. Sorry, I need to shout as well. I keep forgetting. I'm so used to just clicking the hand. I think I'm right in saying, Charlotte, and you can correct me, that the idea is that when someone is going through the Ageing Well guide, they'll be having a conversation with someone, and there'll be a conversation about the things that might be useful to them at that right moment. So I think that's the intention, and hopefully that would cover off. But I take your point, Sheila, that maybe people won't have picked up, that we might not have picked up others who perhaps predate the guide. So just an interesting conversation about how people might interact with that. We could take that away, Charlotte.
Okay, thanks, Councillor DeMay.
Just on what Councillor Peacock said, because I think, correct me if I'm wrong, Sheila, you just want to be able to find out, if you've got a number, you can find out maybe a friend or, get them involved. But I just went on the website and Harringay Googled it. I couldn't really find anything, to be honest. Yeah.
It's like glitch in the system. So yes, if that could be taken away and looked at, that would be really helpful. Okay, thank you. So to number 14, so the Care Act, that's happening. Number 14 is the online portal to enable service users and carers and social workers to have access and review documents. I know you saying a new care management system has now been procured and work is underway. That's really exciting. This sounds brilliant. When do you think this could come into sort of actual working practice, and your sort of thoughts?
I might need to defer to Jenny, but I think it's a sort of 18 months to 2 year process to get the whole care management system up and running. Beverly, thank you.
Yeah, sorry, you're absolutely right. I don't need to add anything to that. There's an implementation phase, yeah.
Well, I'm just really excited it's actually happening. So, yes, okay, so that's excellent. And then number 15, further information around the payment levels to be made to service providers, and about the pay. You discussed the London living wage. And then you say you're just going to give the information in the annual report. So I don't think we need any update on that. I think that's quite self-explanatory. So for me, the bits that I've taken away from this agenda item was the bit around dementia and looking at the east of the borough, sort of a centre of excellence. What thoughts are on that? It's around the mental health centre that I think Councillor Peacock brought up around the Northumberland Park area. Maybe that could be brought into the localities working that we're looking at on the 21st of November. You know, is there a plan for something, you know, a centre that's more Northumberland Park way as well as the Wood Green? I know you've got the big one coming up from Canning Crescent, but is there going to be any sort of other services is going to be further east, I think is the question on that. Regarding social value, it's really good to hear that that's an ongoing conversation, ongoing piece of work, and how we develop the community wealth building. And I think any further insight you have into that will be really helpful, because that's something we've been really interested in. And then it's about the communication and the information and the right information at the right time to the right people, which Councillor Desneves has said, and that conversation around transition as well. That's incredibly important. I'm really pleased that yourself and Councillor Brabazon will be picking that up and discussing how that's going to be developed. So panel, just checking with you, was there any other areas that you think I've missed? I think those are the key ones that I've picked out. Yeah, okay, there's nothing else. Oh, sorry, Councillor Desneves again. Sorry.
Yeah, sorry, I just wanted to come in and say I think what might be helpful for us is to think about how, in terms of that Canning Crescent and Northumberland Park discussion, is just to come back and just to look at what that our landscape and what the offer for mental health generally across the borough is, east and west, and what that looks like. I think it might be quite helpful to have. I know I'd find that useful. Like a summary of where that looks like, and we can liaise with our Barnet and Enfield Mental Health Trust as well, and look at what that looks like. Because I think it's worth checking in and having that conversation, and then bring that back to you.
Thank you.
And that does pick up the conversation that Andrew Wright and Tim Miller were having at panel probably about a year ago about the community offer, and there's been a huge amount of work done to sort of develop that community mental health framework and to implement it. So I think it'd be good timing to think about bringing that back, as you suggest, Councillor Dustin.
It's coming to JOST as well, so the mental health looking, and Haringey is being looked at in particular because we had a pilot here in Haringey, so that's coming to JOST as well on the 1st of October, that community mental health review. So that will be excellent to get further information on. So that for me is the end of this agenda item on the updates on the recommendations. So thank you very much. We are going to just take. So we've got cabinet member questions, and there'll be a discussion around the Grace organisation and the Irish Centre. So maybe we should do that first, and then Councillor Desneves, we could go into your, because I think this probably, you might just get questions on it, or do people just want to take the briefing report as they've got it, and then ask Councillor Desneves any questions as part of the cabinet member questions? So then it might be easier actually. Yeah, happy with that? Okay, so we'll go straight to cabinet member questions. Which is the final agenda item on the agenda pack. And so basically this is an opportunity for Councillor Desneves to give us some brief feedback on any areas that she feels particularly relevant that we need to know as a scrutiny panel, any areas that, you know, that need to be flagged up, or exciting developments or things that are starting. And then obviously we'll open up to questions from the panel. So Councillor Desneves, over to you. Thank you.
Thanks, Chair. So what I thought I'd do is just highlight a few of the things, obviously as a fairly new cabinet member, some of the things that we've talked about as priorities, some of the things that have come up, and then we can go to questions if that's okay. So we've already talked about mental well-being, and as Councillor Ball rightly said what an important issue it is generally, but also what an important issue it's become, and now we're talking about it more since the pandemic started. And I think Beverly mentioned earlier that we've been successful with some funding, and perhaps we could come back and talk to you all about what we're doing with that funding. I think that would be a really useful thing. But it's something that we've put at front and centre of conversations we're having in all contexts, not just when we're talking about a mental health service. But you're quite right, Sybil, that actually it's an issue that affects everyone, and not everyone has good mental health, although everyone has mental health. I mean, it's World Suicide Prevention Day today, and some of our partners are actually hosting an event tonight, and I'd be there if I wasn't here with you all. And I think that's an example of what we should be doing even more of than we already are, which is working with partners so that we have services that look at everything that's going on in the borough, that bring together all the different services and the different aspects and the different knowledge and understanding, so that in the case of World Suicide Prevention Day, we've got a strategy and a group that meets regularly that are delivering that. But what that's enabling is that people are not feeling isolated and hopeless. I think that's really important to us, and that's an example of the kinds of conversations we're having around how we can continue to make best use of collaboration. I think in the borough are really important. I think we've done a lot of really good work in that respect already, but perhaps we could bring back something on some of what we're doing with some of the funding that we've had post-pandemic. I wanted to say something about care, and on the care front, particularly because we've already seen a rise in demand because of COVID, people with more complex needs, from a single handle to a double handle, new cases of people who've never had care before, and also the impact of long COVID. And I think that's obviously of concern to us and something we need to be delivering for, helping people with. But our lack of prospects of any stable funding or kind of strategic approach anytime very soon from government continues to be a challenge, I think, and especially because we'd like to see a lot more investment in workforce, and that's a concern in terms of both having enough people and having the right amount of people in the right place. So that's something that is on our mind, and unfortunately, we don't think that I don't think the recent announcements will help us. We wait until 25 or 2025, 2026. It's a bit of a challenge, really. We've already been waiting for so long, and I know many of you here will know that anyhow. In the meantime, we need to be on the ball. We've committed to paying London living wage, and we need to make sure and keep making sure that our providers are paying that. Only this week we've been just talking about how we make sure that actually we're not advertising anywhere in Haringey roles that are below London living wage, given that that's not what we're paying for and not what we've agreed to do. So that's an important commitment that we keep managing. You will be familiar that co-production's been a really important part of this portfolio since 2018, really, and it's really successful, and we've learned a hell of a lot through projects like Osborne Grove and recently Burgoyne Road about how to work with service users, people with lived experience, with the community, to build projects. And I think, but now I touched on this earlier, what we need to think about too is how we then can engage the community in commissioning services, and also how we work with service users, people with lived experience on governance and helping us manage service and monitor how things are going. And that's a learning process for us too, but it's something that I'm certainly personally committed to. And really important in that is involving everybody and being inclusive and thinking about equality, diversity and inclusion within that involvement. Violence against women and girls is a really important area for us. We know that women have been disproportionately affected by the pandemic, and certainly that violence against women and girls has increased during the pandemic, and that's having an impact on people throughout the borough, our families. We are looking at ways that we can bring in more funds to resource this area. And some of you will have seen that we have a bid with the Home Office at the moment looking at safety at night for women, and that's an example. And I hope there'll be others, and we hope there'll be other opportunities And we won't know about that bid until November. And of course, these things are always a short turnaround, so we had very little time to put it together. But managed to put out a quick survey just to glean some knowledge and understanding that will contribute to that bid. But I hope if we're successful, that will be another example of where we'll be able to work with the community and with providers in the borough and women with lived experience to inform what we're doing. Food's an important, it's here in my portfolio, and we've been talking only this week about how we can support the Haringey Food Network, how we can be really strategic about what we do, so that, and I guess the agenda is about raising, ensuring rather that people are not living in food poverty, and raising the issue from perhaps a food bank to something at a level that provides great dignity and allows people to access good food in a rate that they can afford. So we're thinking systemically about how we as the council can support. There are lots of really good projects already happening in the borough, but also trying to think about how we can link up food in schools, food in older people. Some of you will remember Meals on Wheels, but are there models and are there things maybe in the medium and longer term that we could do in the borough, but in the short term too, just thinking how we can support. There are lots of really good ideas, community supermarkets and all sorts of other that could help people access good food, and we need to be thinking strategically as a local authority about how we can do that. I think quite a few of the conversations that we've had since I've been cabinet member, and I'm sure it's the case with the previous cabinet member, been about how collaborative working can help us do more and deliver better. And only today we were in a meeting about some work that we've got funding for on substance misuse, which is actually about us and the criminal justice system and mental health coming together and working to help people who are kind of in and out of cycles in the criminal justice system, perhaps in prison, perhaps being arrested, etc., but actually have a substance misuse issue in their lives, and how we can support them through a therapeutic journey, which will perhaps help them break that cycle. So I think that's very much an example of the kind of work that in the council and in this portfolio we'll be looking at, bringing together the different disciplines and working together to try and find solutions, and hopefully make people feel well again and feel able to be contributing actively in the community. I think I can't not mention our ongoing pandemic response, and that continues to be an important area of our work. And at the moment, some of the very live things that we're talking about at the moment are supporting schools with ventilation and air quality monitoring, particularly because now that we don't have bubbles, etc., that there are risks involved for families. And we've had raised with us the significant issues of both children and families who are clinically vulnerable, but just generally being responsible. And of course, the government has now woken up to the issue of ventilation and supporting schools, but we are very much looking at how we can use funding that we have already in order to support schools and monitor the air and make sure that they're ventilating well to reduce the risk of transmission of COVID. And high on the agenda is also continues to be vaccination. You all will have had lots of updates, I think, in the past, and I can see Will's on the range of different activities that we're trying in order to make sure that we engage with everybody. I know recently we had jabs in Primark, and I don't know, it's probably not how I would have thought to have my vaccine, but I do think that it's important that we try these different mechanisms and that we engage, especially with young people. I think in all likelihood, I'm hopefully not telling any big secrets, we will be asked to vaccinate 12 to 15-year-olds. But we do know that there are challenges also because the national message around it not being hugely beneficial means that we may well face challenges on numbers. Likewise with other sets of young people. Will may want to come in and say a little bit more about that. And I think I've blathered quite long there. I think I've covered quite a few of the priorities and themes that are on our mind at the moment. So over to questions.
Thank you, Listeners, and you've given us a very good and quite detailed understanding of what you're currently looking at. I'm opening up to the panel. I'd ask people to only ask about 2 questions, just due to time. Okay. Does anyone want to ask anything on Grace Centre before we go into general questions? Or so basically we've looked at the Grace organisation and the Irish Centre. So we've got a report that's a briefing note that's come to the panel because myself, Councillor Peacock and Councillor Bull went to have a look the other day at potential move of the Grace organisation to the Irish Centre. There were a couple of thoughts that I just wanted to raise, not necessarily about that, but the secondary part was that the Grace Centre potentially, and I'm saying potentially because obviously these are negotiations, will be occupying one part. Then there's a discussion around the community aspect and the council running that community space for the community and that provision. And I think during the walkabout with officers, I think the bit that I was unsure about was about the funding of that. So capital funding needing to ensure the building is fit for purpose, to be used as a community centre, because it is in a slight state of disrepair, I think, and then sort of ongoing funding about how that would be, any community centre would be delivered, where that funding potentially would come from. So those are just questions that I had, not necessarily about the Grace, but about the rest of the site, because they did look like it needed a little bit of TLC on the outside as well, to be absolutely fair. I think it's weathered many storms over the years, and it's stood the test of time, but I think even I could spot there were a couple of areas that might need a bit of renovating. So it's just really about that funding aspect of it and whether anyone on the call today can answer that. If not, I'm very happy for someone to come back to us as a scrutiny committee on that. And then I'll take questions from the panel. Thank you. So Councillor Snowson, so you've got your hand up straight away.
Yeah, thank you. Well, I was just thinking it might be useful because it's not entirely all in my portfolio. And Charlotte might have Charlotte and team might have some things to say, but just thinking it might be useful for us to bring back something written as well with more detail on that one.
Yeah, very happy with that. Thank you. Councillor Peacock.
Well, as Charlotte knows, I sent her an email to her today because I was so upset about what I saw in the Irish Centre. And as you know, I was vice chair of that centre for many, many years. I've known it so well. And to see it treated in such a shabby way absolutely broke my heart. And you're talking about food banks. We went into one room and there was still food there. And now it's past its sell-by date. And we went into another room. There were lots and lots of bottles of drink, which hasn't passed its sell-by date. Food banks could have been using all that stuff. And it's just as if someone had just walked out the place and left it. The place is disgusting. I'm really, really upset. And why certain things have been done. And I have been asking to go there. I've been asking about it. As Charlotte knows, I wanted to have my party there in September. And I was assured by Charlotte I would have my party there in September. Well, there's no way that I could have my party there. It just broke my heart to see how the Irish has been treated. Absolutely disgusting.
Thank you, Councillor Peacock. And I did read your email this evening. The place is currently, in effect, a construction site. There's a huge amount of work going on, which is compliance work, which needs to be done. It means that it isn't in the place that we want it to be. Absolutely, completely agree. And it was left in a state that means we had to do quite a lot of work as a council. And to the question earlier, we've invested quite significantly in those compliance works. In addition, we will be doing enhancement works and spending more capital should Grace relocate there in the coming months. So absolutely, we're investing in the building. But I think it's fair to say that this is not, it's not the finished state. It's not in a state to welcome any members of the public. The current licensees are not able to use the building. So it is a work in progress, and it's, it's probably at its worst at the moment, but with a view to making it better going forward. So completely appreciate that. My understanding of the food left there is that it was beyond its sell-by date when we inherited the building, and so there was very little we can do with it. That's part of the whole clearance works which need to happen. Clearly, it's not in a publicly open space. You were permitted to visit as part of the construction site because you were making the scrutiny panel visible. It's not a publicly accessible building currently.
I were the three councillors never ever involved, never told anything. We've asked and asked to be involved. It's in our ward, and we have never been told anything, and it's not right.
Well, there have been a number of meetings with ward councillors. I have spoken to you on a number of occasions, Councillor Peacock, and we have had meetings with other ward councillors. So I think that it's fair to say there has been some involvement and trying to keep you up to speed with that. But apologies if you felt that hasn't been adequate. I do apologise. It's been a moving feast. We've tried to keep up with the timetable of compliance works. They've taken longer than we had anticipated, but they are more all-encompassing and comprehensive than we had anticipated were necessary at the beginning.
Okay, thank you, Charlotte. I think there's obviously we'll agree to, I think there's a difference of opinion, but I think we're going to leave it there because thank you for your response to that. I've got Councillor Bull who wants to come in.
So I'm on my other laptop, so I haven't got the video link, so you have to apologise. I'm sure you can hear me. Just to follow up on what Councillor Peacock says, and it's a more strategic-based question. This is a really good example of a council community building that stopped being used by the community and should have been passed back to the council on the council's property team. Now, I understand what you're saying about out-of-date food and all this, that, and the other. Can anyone tell me when the Irish Centre actually stopped being run by the Irish Centre organisation? The date?
July. It was last August. The building is in the. We are working on it as property. Property colleagues are working on it. It was handed back to the liquidators last August.
Charlotte, with all due respect, it doesn't come. I don't think the responsibility of this. It's all very good for you to try and defend the council, but it doesn't. I don't think this comes under you. I think it comes under the property team, because the issue is, quite frankly, and I don't know if you've been there. It looks like there was an episode of Star Trek when something affected a ship and everyone just died on the ship in mid-motion. And that's what the Irish Centre looked like. It looked like someone had just clicked their fingers and everything had become inanimate. It was horrendous to see. And if that place ever got broken into, someone would have a field day. And I'll shut up in a minute. The flat screen TVs were still up on the wall. The booze was still in the optics. This is not down to you, Charlotte. This is down to property. And the reason why I'm making the point is this is another example of when an asset goes back to property and they don't seem to know anything about it. It's down to the property department to manage it. And I can't remember who the new assistant director is, because Christine Anderson's gone, isn't she? I don't know who the new AD is for property, because I'm obviously out of the corporate loop at the moment. But this needs to be, both yourself and Beverly, if you'd be so kind, take it back to property, because this is another example of where property have failed this council by not taking over the responsibility of the building. They should have gone in there and cleared it out. There's community stuff in there, furniture and goodness knows what else, which could have been given to the community. It's just sitting there. There's still PCs in there, for goodness sake. I want to shut up now. It's a really important point, and it needs to be picked up by Urban Street, because it really puts the council in a shocking light. If it was out to the public domain, it would get taken to the cleaners.
Okay, so I think as Councillor Bull said, this probably doesn't fall under your remit. So it's just because we haven't got housing here that you happen to have sat in on the point where these will be made. So I'm going to bring in Councillor Snebbs.
Thanks. I think the point's taken. I think from what I understand, the building's located in sort of July, August 2020, and I think you've made strong points. And I think all we can do is commit to having some kind of written response come back. And I think also perhaps through OSE you could reach, if you want to have that conversation. But I think we've committed to feeding that back, and there being a flow of something written back, Heard loud and clear.
Thank you, Lucia. Very kind. Very good. Thank you.
And I think that would help. So I think the 3 councillors on the ward, I think would really appreciate that. I can see nods coming in this direction. So thank you. That seems to be really helpful on that. So we've got questions about Councillor Desnev's the rest of the portfolio. So is there anything that anyone wants to ask specifically around any areas that have been mentioned? If not, I'm going to ask a very quick update on Oswald Grove, because obviously that wasn't part of our response on the day centre. So if anyone could give me a very quick update, just because I'm obviously really interested in that, that would be really helpful. And we've talked about dementia care, so I won't re-ask all those questions again. I think Councillor Desnev has answered quite a lot during the other sessions. But the final bit that I wanted to ask on, you mentioned it was Suicide Prevention Day. We did, part of our scrutiny, we had an understanding that this was going to be gained from the council through and again, this is housing, so this isn't your portfolio. It's only just because you mentioned that you were talking, you would have been in a larger group meeting tonight. I seem to remember we were going to have some feedback about working alongside the contractors, the building contractors in Haringey, because there was a high rate of suicide amongst young men who worked on the building sites. And that was a few years ago now, and I'm just doing this from memory. So it's only because that triggered that thought. So not necessarily an answer now, but if we could have an update, that would be really helpful, because that was something we followed quite closely for a couple of years, and then the pandemic sort of swayed that, and we've lost track of that a bit. So if there was any update on how that suicide prevention is going within the construction industry, particularly as we go into larger stages of construction in Haringey, that'd be really great. Thank you.
So I thought I might come in, and then everyone else can fill in. Other officers can come in with any other detail. Osborne Grove. Actually, we've got. I was at the meeting, at the last meeting, with a fabulous, I think, design, and a really, I think it was a really good, it really shows what you can do when you've got a group of people around the table, and, you know, credit to everyone who's been involved in that process, I think, really. And my understanding is, and Charlotte may be able to fill in a bit of the detail, that we'll be going out to more public and wider consultation soon. Just a really interesting question on the suicide prevention. There've been some I've attended one of the suicide prevention group meetings. The group brings together people from across the borough working on that area, and so we could take that back to them and ask. But certainly, we've had some good discussions around the figures around prominence of different groups, and I can see Will's turned on, so he might well want to say something. But I think it's a really interesting thing that we should come back to you on.
Okay, thank you.
Will.
Hi everyone, I'm Will Miraris, I'm Director of Public Health for Haringey. So of course we came to scrutiny on suicide prevention pre-pandemic, so we're talking about 2 years ago, and that was one of the areas that we were going to prioritise following that discussion. So after that scrutiny meeting, I went with members of my team to talk to a forum of representatives from the construction industry. We went over to Tottenham Hale and met in one of the sites as a group that the council engages with, and shared information on suicide prevention resources, mental health at work resources, and those organisations had a real interest in that, and some of them already had wellbeing at work programs. That was just pre-pandemic, and then work and focus shifted very quickly to the kind of emergency response to the pandemic. But through the pandemic, we've actually built really good links with the construction sector on things like COVID testing. So it's certainly one where we can revisit the progress that we'd initially made. So thank you for raising that, Councillor Connor.
No, that's really great to hear that. It's good to hear back what happened. So I remember the point. I remember an officer stopping me in the corridor saying, "Oh, we're at this point," and that's obviously the point where you're just going out to speak to them. So it's good to hear back that what happened, and that you're going back out again. So that's really positive to hear. Thank you.
And Councillor Connor, you might want at some point to have a little bit of a a bit of something come back to scrutiny from the suicide prevention group. There's some really interesting data presented about suicide and suicide prevention as well. So you might want at some point to have some feedback from them as a group. They're very active.
Yeah, that would be great. Thank you. Anything on suicide prevention, we would be very happy to take as a panel. So thank you for that. I've got Councillor Demir who's got a couple of questions.
Yeah. So, I mean, just on suicide prevention, I was just reading that between 2014 and 2018, Haringey had rate of suicide was something like 10.3 per 100,000, and we were the 5th highest in London, and now we are something like 8.1 per 100,000, which is the 17th highest in London, which I suppose, is good. The rate is going down, which, it's still high, but I mean, I think primary population that it does affect is males, 25 to 44-year-olds, mainly in that category. Sorry? Oh, yeah. So I mean, I suppose I don't know if the suicide prevention strategy is helping that, or it's just a national statistic, that, national trend, but, it's really good news to hear. I just have 2 quick questions. So I appreciate, Councillor Neves, that you're recently in post. So I just wanted to ask about, in terms of, because we've had a discussion with Centene in June, and we had a kind of a briefing, or a kind of a Q&A that was sent to us. What kind of involvement or discussion you've had with North Central London PPG to ensure that Centene and other kind of these private care providers are held to account, and what we do from the local authority perspective to do that, and what you've been doing, if you've been doing anything at all. And again, I appreciate you're quite new in the post. And second question is, and this maybe for officers as well, is that obviously with the government now announcing national insurance contribution is going to be rising to fund social care as well as the NHS, what we expect, if any, of that funding pot to come back to Haringey.
So maybe I'll come in and then officers could come in, especially on that second one. So that I was still actually on JOSC, on the joint health scrutiny, when the Centene thing first, I guess, blew up. I think it's fair that no one was satisfied or happy with how that process took place. Unfortunately, it's not something that we control. The conversations are really around what the contracts look like and how their length, and then what happens when they can be reviewed. I think you're probably aware, because of your day job, that actually we don't have a terrible amount of control about what takes place. I'm very clear that personally I think the process wasn't good, and actually we're all very concerned about the slow creep towards privatisation generally in the NHS. It's a big worry and across the board, and but I think also there are conversations taking place outside, I guess, council's work for me around how we campaign on those issues that we're passionate around in terms of the NHS and in terms of private providers. I think I regularly attend the primary care commissioning group and can raise issues there on both the nature and quality of care at the moment. There are plenty of challenges in primary care. I was in a meeting today just around both, I think, shortage of workforce and the demands and pressures at the moment. And we've had some really quite sophisticated conversations today on a briefing around our concerns about people accessing primary care, the prominence of digital offers, and people, on the one hand, some people that does work for some people, but for many people, we're also concerned about people being able to be referred in to secondary services when they have an issue, and particularly pertinent at the moment because of the potential for backlog. So I think you're right, there are some real issues, and we have to just keep talking about them and raising them, and they're regular things at conversation, the things that will come up through our work with Health and Wellbeing Board. They're things that will also come up in this conversation with to do with integrated care systems, and I think although that's sort of the topic in itself for another day maybe, but those live issues. What remind me what your second question was? Apologies, it's late in the day now.
Yeah, no, that's fine. Just about the funding that we expect to come. I see that.
Okay. Yes. Yeah. I mean, look, the officers can say we'll talk in one way. I guess I'll speak in another. I don't. The reading of what's come down from government, it looks like I don't think we'll see much change on the social care front before 2025, 26. You know, and I don't feel that hopeful, and I think I said that when I spoke earlier that I think we have for such a long time in social care had uncertainty on funding and what happens, and we need real change and real reform. It seems quite clear that any funding that is available and is in any way connected with social care might well be connected with integrated care systems, but that's your politician's answer. And I'm Beverly coming.
Thanks, Councillor Dusnes. I think the politician's answer is not too far from the officer answer. I think the first thing to say is there's still a lot of unclarity about the government's announcement, and the devil is in the detail. But certainly in terms of the headlines, 5.4 billion over 3 years. The focus of all the headlines have been about the cost of paying for care. And the cap. So if you take away that, there is very little left for social care reform. So what I call, the proper focus on how you can have parity of social care with our health services. That's about working conditions for our staff, pay for our staff, training, development, etc. Could go on and on. So there is nothing in what's been announced for that. That's very, very clear. What they have said is that there will be a white paper in the autumn, but we've been hearing that for many, many years. And also there's the spending review in the autumn. So I think we await to hear the further details, but what has been said quite vocally is woefully inadequate in terms of any meaningful impact on social care reform. Thanks.
Okay, thank you. I'm going to close with last couple of very quick questions that have come up recently in the sort of news. So again, it's just sort of, your sort of thoughts on this. So today we heard about 3 people that died who had learning disabilities within the private hospital. So, I mean, a question obviously for us is, in Haringey, do we have any of our residents who are out in any sort of private facility, in similar, and I'm going to hopefully assume that we've not, but I'm going to ask the question anyway, because obviously this is the topic that's coming out today. So it's just around safety of our residents. And then the second question is around, and this might be more for Will, about the call from the government for care staff to be immunised. And I know that we've discussed before about concerns around this. We've already got a high turnover of care staff, especially social care setting. I think somebody quoted on the radio the other day that it was 40% turnover. I can't remember over the period of time, but it seems an awfully quick period of time. So it's just really, are we in Haringey enforcing or going to enforce the government's proposal that all care staff be fully immunised against COVID-19? Thanks.
I didn't quite catch the last one. Are we going to enforce? Sorry,
Beverly, the last one was for Will.
Oh, sorry.
No, I think it's for you. I think it's for you, Beverly, because it's about mandatory vaccination for care home staff, and it's going to be a legal requirement. And the other part of the question was, what are we doing about that locally? So I think you're probably better placed than me to answer that.
Yeah, sure. Shall I take that one first? So Yeah, as well as said, we have no control about whether we will enforce or not. It is a legal mandation by the government that by the November the 11th, all staff working in care homes must have been doubly vaccinated. I think the first thing I want to say is just in terms of the work we are doing, it's not just focused on Haringey, because obviously we commission across the sub-region. So it's very much an NCL activity. There's really sort of coordinated, integrated work on collecting the evidence, daily calls of support from our commissioning team to all the care homes, very much a risk management approach to where particular providers might be at risk, and looking to see what contingency and mitigations can be put in place. But it can't be just a Haringey focus. It has to be very much that sub-regional focus. In terms of workforce, you'll be aware that I think, lots of headlines, care providers really very alarmed at the implications for the mandation of vaccine, coupled with the impact of Brexit, almost a perfect storm in terms of the care sector in terms of workforce. And we know that some people, we won't know until September the 16th, which is the cutoff for the first vaccine, how many people will actually walk away. But we do get the sense that some people will walk away. So really, we are in communication with the HSC, very communication about the London regional situation, the sub-regional situation. So they're keeping a close tabs on the current situation. The other aspect of the mandation is that it's not just staff who are working within care homes, but anybody who goes into a care home. So that's, if you look at council employed staff that may have to go into care home, we've done really rigorous risk assessments in terms of our ability to be able to deploy staff into care homes. And from that regard, we feel we're fairly got a really good, robust risk management plan. We've got detailed information around the status of our staff, and we feel we're able to cover any necessary deployment. We're also working with the care homes in terms of trade staff, because if you're electricity or your plumber or whatever, if you go into the care home, you've got to be doubly vaccinated. So we've been working on comms with the NCL, CCG around two aspects really that enhance information to trade staff. They're producing some leaflets that we can give to our care providers, so to remind them about the importance of being vaccinated, having a list of tradespeople that they can call on, etc., etc. And then the other one, which I think is really important, is really about an open door policy. So we know that some people won't meet the deadline, and they may go off and work in Lidl's or whatever, but actually we want to leave the door open because we know a lot of staff are still hesitant and may well want that opportunity to come back at a later stage and change their mind about getting vaccinated. So there's something around, we've developed a very empathetic letter, which is, for me, it's really about leaving the door open to continued conversation with staff who may decide to leave because they feel they've been pressured or bullied by the cutoff point. But once they've had some time to reflect, it may be a different story. So quite a range of activity and strands, but it's obviously something that's extremely high priority for us.
Thank you, Bevan. And there's just a question on people with learning disabilities in the private care system, just following days.
Yeah, it's really unfortunate that happened in Norfolk. It's really unfortunate 10 years or more after Winterbourne that we are still having these failures in our health and care system. So obviously, from our perspective, we have some people with complex needs placed out of borough in what I would call sort of specialist provision. There's very active work on our part to create those relationships with the provider so that we can sort of assure ourselves of the quality assurance of specific provisions. And that's always been part of the way we work.
Just to be really clear, sorry, a slight disturbance as somebody was moving around. So just to say that, so we are assured, are we, as a council in adult social care, that we have got that relationship with all the care providers outside of the borough, so that we're confident that they're in a good quality environment, you know, that the care standards are high, you know, good or, you know, excellent on the CQC rating. So I'm sorry, Beverly, I think I just missed some of your bit you were telling me earlier.
So I am certainly not going to sit here and say 100%. I'm going to assure you that there won't be any failures in our arrangements. What I'm saying is that we do have arrangements when we place people out of borough to make sure that we oversee, we have close links with safeguarding teams in the placing authorities, with social work teams, etc. I don't think there's any authority that can actually say we've got 100% assurance around quality assurance. That's why the CQC are there to do a role. And obviously we work very closely with the CQC and we respond to both their sort of inspection regime and also our proactive work.
Yeah, sorry. So I think I didn't mention the word CQC, but so their inspections are good for, you know, above good, aren't they, for the care providers where those clients are placed?
Yeah, but you have to remember that people may be placed at a time when this CQC rating is good or excellent. I can't remember what the other one is. Good or outstanding.
Outstanding.
But that can change over time. So, and what our approach is, if there is sort of that reduced quality assurance, is obviously to work with the provider to make sure that they're supported as far as possible to improve their performance. We've had occasions where we've had to work to close down provision where that hasn't worked out. So it's very much quite a dynamic situation.
Okay, but we've got that system in from what I remember, if people complain, so if a relative or anyone brings up any concerns, so I think this was the situation that people bring up concerns and they weren't being listened to. How, you know, unfortunately this is a recurring theme, isn't it? But my understanding in Haringey, if people do bring up those concerns, then that gets flagged up with yourselves, doesn't it? And I know I've got Cancer Plus Nerves and that Wills, and I'm not sure. I can't see so well from here, so Cancer.
Yeah, I think it's a really live issue, and you know, safeguarding should be at the top of all our lists. And I think if you wanted us to come back and just explain what the process is, to bring something written to you around the processes, if that's useful, then we should do that.
Okay, thank you. Will, sorry, did I see your hand, or was that?
Can I just say, sorry, can I just to finish off that point, there is a well-established establishment concerns procedure, if I can put it that way, and we're happy to share that because I think that illustrates the way we work.
Thanks, Beverly. That'd be really helpful. Thank you. So thank you, and you know, Councillor Plus Nerves for being throughout the whole meeting and joining in. It's not just in the cabinet question times, I think, and some of the issues were raised as part of the other items, agenda items. So thank you, and thank you to officers for coming on. I know it was a long meeting, this one, but you know, we do sort of like to spend time scrutinising the areas. So thank you everyone for attending tonight. The panel, we still just have to quickly make sure that you're fine with the work plan. So I'm just going to briefly go through that with you at the end of this meeting. So thank you. There's a couple of points on the action, Beverly and Charlotte, but I'll just email those rather than do those now. If that's okay. I think we'll close the meeting at this point. And I've got a couple of points on the action, but yeah, an email can be sent. So thank you.
Thank you.
Thank you, Chair. Thank you, everyone.
Thank you.
Good night, everyone.
Thank
you.
Right. So on the work programme, so it's page 35. Yeah, agenda item 10. So we've got the Adult Social Care Commissioning review in progress. That's being reported on. So it's really interesting to hear about social value. So I think Dominic and I will be following up on social value.
We're having a discussion next week.
Yeah, excellent. So the sheltered housing, I'd still like to change that to sort of health and care within sheltered housing. Otherwise, it does look like we're on a housing panel. So so just to let you know, that's on the 29th, September the 29th. It's starting at 10, we're finishing at 4:30.
Yeah, we're down for that.
Excellent.
Is it virtual?
No, I think it's in, is it in?
It is online, I believe.
Oh, is it online? Okay, so it's online. No, well, I think in the short space of time we have, because we're dealing with quite meaty issues, I think if we then went out to visit something as well, that would take up most of our thing. But we are hopefully going to get a visit in on the locality working the Northumberland Park area.
Yeah.
So that's
this current Northumberland Park area or the next Northumberland Park area.
I don't know what the next one is. It's
the top that way. And so I lose Dowry House.
It'd be based on the current one.
The current. So basically, it's the locality working that we were going to take, but then we didn't because there wasn't enough information from officers on it. So it's coming to the scrutiny panel on the 21st of November, but we're looking to do a mini bus tour beforehand, so that councillors can go and have a look at areas within the locality to look at, what this new offer is. Because
I know every single one.
Well,
visiting every single one.
You will be there as our guide, Sheila, but officers have told us there's going to be these new projects, there are different pilots happening, so we thought it'd be really useful to go and speak to people on the ground, like you said, about going to.
I provoked it by having a discussion with Gillian Taylor about how I would like to see it.
Okay.
And it's failed additionally by releasing the parent families with babies in 2 sheltered kids. I thought it would be nice for the young people to have older people there and that grandparents.
So that's the centre point one. So I've actually asked Beverly and Charlotte the centre point report on that. So I'm hoping we're going to get that report. So I've asked for that to see that as the chair and see, okay. So well, I think we need to learn from it. I think it'd be useful to understand because we've still got all this cohort of residents we still need to house, and they still need to get health, social care, lots of other different types of support in the sheltered housing. So it's where we place people and how we do it.
The problem was, officers came and had meetings with residents and told them, don't worry about it. Each one will have their own washing machines. It won't impact on you in your each one will have this. Never happened.
Okay.
Never happened. So what happened was they took over the laundry because with young children they had to use the laundry wash machines all the time.
And it just all went to pot.
Yes,
okay. So we've got for the November meeting we've got the Harrogate Safeguarding Board, which is good because then we can look at the what was Beverly saying at the end, Dominic? Was it the stuff about the reports that they have on providers to ensure that if they get feedback from residents complaining about the system, it's called something with E. Well, anyway, it's right at the end, but Beverly said we'll send you that information, and that's part of the safeguarding, so that would be very useful. We've got the locality working overview, and then we've got the update to the Joint Partnership Board living through lockdown, which we were supposed to take, but then there wasn't a lot of information, so we had to push it to the November report. So unless you've got any queries with that, I suggest that thank you very much.
No, that's all good.
The meeting is closed. Thank you. Thank you to Dominic for his time spent organising the meeting.
We need to speak to the other people on this panel, so if they're not coming, they should give their apologies. It's quite discourteous, isn't it?
Well, it wasn't. I'm a bit surprised. Other people didn't turn up.
Very fair.
Was Eldridge and Mark?
Yeah, I mean, that's fair. Well, Nick said his apologies.
Yeah, Nick let me know that he was stuck in a.
Nothing there.
Sorry?
Right.
I think we made up for it.
Yeah. There was lots of good questioning, I thought.
I feel in a way sorry for Charlotte because I feel that every time someone disappears and she has to take
over that extra.